to speak. And, yeah. One bad test.
All right, we'll get started here. So we'll start with the pre-meeting and budget amendment. Mr. City Manager.
Thank you, Mr. Mayor, members of the council. Good evening. We have a budget amendment request that we'd like to run by you, and the reality of this request is that it's part and parcel to our ongoing efforts and work that we've undertaken to gain access to the CARES funding that we hopefully can bring into the organization's coffers, if you will. We have an outstanding balance, if everything goes well and the provisional approvals follow through and come to pass like we think they will, of about $1.7 million. And this amendment basically gives us that opportunity to not only seek that unanticipated revenue, if you will, but also provides for limited spending authority as it relates to some of the projects that this would cover and that are consistent with the application that we've talked about a number of times here in these meetings. I have Mr. Pitlick here tonight to answer any other more detailed technical questions if you'd prefer, and you know, with that, you will see this coming forward tonight. As you all know, time is of the essence for this process because they anticipate that we need to have all these dollars spent and otherwise accounted for by the 15th of December to allow for the state to meet their deadline of having those dollars spoken for by the 30th of December. And so if it feels rushed, it's not because we're trying to ram something through, it's because we're trying to follow to the letter the dictates that these programs require. So with that, Mr. Mayor, if I can invite Mr. Pitlick up, please.
Okay. Mr. Pitlick.
Thank you, Mayor and Council. I really don't have a lot to add to what the city manager has said. Again, it's for $1.7 million, and certainly don't need to spend it all, but we do want to have that expenditure authority there. So as the opportunity arises, we have that authority to make those expenditures and seek reimbursement.
Does anybody have any questions for Mr. Pitlick? Okay, thank you. Do you have anything else on that, Mr. City Manager? Okay, so we'll move on to Community Relations Spec update. Mr. City Manager.
Thank you, Mr. Mayor. This is a follow-up item with regard to a request of the council, maybe as long as a year ago, I suppose. We now have a construction season under our belt with respect to the implementation of this community relations spec in our contracts that we enter into for projects and so forth being done within the community. I've asked Andrew to prepare some thoughts as to how it worked, and maybe we can share notes with you tonight with regard to any feedback that you might have received throughout this construction season. And so with that, if I could defer to Director Beamer for some briefing on that matter.
All right, Mr. Beamer.
Mayor, Council, we spoke briefly on this last week at the work session. And we do have one complete construction season under a belt with this spec in place. And we've only added this spec to 3 of our larger capital projects. One is actually yet to take place, but we got it on Midwest, the second phase of Midwest that's currently under construction. And we've got it on Ridgecrest Zone 2, Zone 3 waterline replacement project. It is intended for this to be somewhat of a living, breathing document that we can reconvene with contractors and our consultants and our own staff afterwards to see how well it's working, if anything needs to be tweaked. Certainly we've had to tweak some of the stuff already because the resident communication plan requires a neighborhood meeting, which obviously is not possible in this day and age of COVID. So for Ridgecrest, we actually just sent out postcards to every resident that might be impacted by that construction, let them know of who the contractor was, who the consulting firm was, who the staff person with the city was, and all that contact information, what they might expect to see during construction. For Midwest, we actually did have a business owner meeting here at this atrium here at City Hall, but we did manage to social distance. I think, Councilman, you were present there, I believe, for some of that. And some of these things are not unique. We've had neighborhood meetings before in larger projects, but this just formalizes that requirement and lets the contractors know what we really fully expect. And I'll just go over some of the other highlights. We require them to have identifying clothing. We would be on projects and we wouldn't know who the contractor was or his workers were because we wouldn't know. So now they have to have hard hats and safety vests with the actual company logo on, and we have to be able to identify who's the foreman out there for the contractor or subcontractor, and who has authority to speak to the residents on behalf of the contractor if a situation will arise, and it's important that the person who knows how to communicate with the public do so, and not just the person in the ditch who's not very happy and maybe grumpy that day. So, a conflict resolution. We expect conflict to be handled appropriately and for it to be escalated as needed up the chain. You know, hopefully it can be dealt with by the contractor on site. If not, it can be escalated to the consulting engineer or city staff person, or ultimately up to my position or to Carter's position, and hopefully it will alleviate you guys getting phone calls or emails as to how well or well not a contractor is performing on their street. So we talked about the project kickoff meeting, and again, this is not a unique spec necessarily, because we have required neighborhood kickoff meetings before on larger contracts. And project signs, you will notice that we have project signs up, and again, this is not terribly unique because we've been placing project signs for a number of years now, primarily to promote the optional 1 cent sales tax and to let them know that this project is indeed funded with that funding source. But again, it just helps formalize and let contractors know what to expect. So we're getting some feedback that, hey, how come your guys don't have City of Casper logos on your safety vests and your hard hats? And that's probably a legitimate complaint by the contractor. If we're going to require them, perhaps we should be doing the same thing for our own work crew out there on the job site. And again, so we will be reconvening with contractors and some of our engineering consultants and our own staff to see how we might tweak this to make it better for everybody. But that's a very quick update on where we stand with the resident communication plan. I'll be happy to answer any questions.
Anybody have any questions of Mr. Beamer? And I think Councilman Pacheco's on the phone. Do you have any questions?
Oh, I think I'm good. Thanks, Mayor.
Okay. All right. Thanks, sir.
Thank you. Thank you.
Move on to Health of Community Status Report. Mr. City Manager.
Mr. Mayor, included in your packets was a list of suggestions by not only members of this group, but also some staff recommendations as well and suggestions that staff has been thinking about also. With the intent to, provide the opportunity, if you will, for council to have some conversation with respect to steps that the council would like to see take place that may be over and above what we're, doing now as a community to help dampen the curve of our current surge that we're experiencing of infection rates and so on throughout the community. As you can see, some of these things are suggestions and discussion points that don't necessarily reside solely within the authority of the council, but nonetheless are ideas that obviously some of you have been having and sort of deliberating in your individual minds as well. Furthermore, there are suggestions here that are very internal also that obviously impact the way we conduct operations with our community. And if indeed they move forward, we wanted you to be aware of those potential implications and impacts. One of the things that I think indeed would need to happen would be with regard to ramping up our presence, as it were, in interacting with the community on behalf of mask requests and provision of masks as folks enter into our buildings. We've got a model of that occurring right now in City Hall, but we haven't done that and proliferated that model throughout the organization, or at least in the buildings where we get a lot of customer contact. And so, these are things that we'd like to have you think about, and certainly if council has any direction, some of these may require some additional formal steps. Some of them may be fairly operational in their implementation, and may not need those extra levels of approval and so on. So with any of these items, we would like council to give us that direction as to which way you'd like us to go, even if there's only 2 or 3 of these out of the list that you would like to see some follow-up on. And so with that, Mr. Mayor, I defer back to your group to entertain any questions or additional discussion.
Well, I'd like to make a couple comments real quick. Some of these things on the list, I think we've already put some of this in place. And so the manager and I had a conversation this morning with the regional manager of Walmart and Sam's Club, and we've already had discussions with her as far as what the future might hold for us if we in fact do end up at a mask mandate that ends up being statewide. But along with that, we've also had conversations with community leaders within church groups, just bigger groups that actually touch more people, and those have been more so to get the word out that obviously we have a surge going on with the virus itself, and just reminding people it's not necessarily about a mask thing. It's about, stay at home if you're sick, and everything we've been preaching for the last 8 months, and just getting those words out to people. So that some of that stuff's already in place. In my personal opinion, I think we start talking about and I guess maybe somebody could explain to me a little bit differently to change my mind, but closing bars and restaurants and putting that at 10 o'clock at night, the virus doesn't stop at 10 o'clock at night. It doesn't start, it's there, period. And so to me, when we start limiting establishments on what they can and can't do to a certain amount of time, I mean, if you're going to put a time frame on it to close it 4 hours early, you might as well just close it all together, in my opinion, because you're going to get sick when you're going to get sick. So that's just a couple of things that I'd have right off the bat. The biggest thing is right now is things are out of control. I'm waiting actually for Dr. Dunn to give me some numbers for today for where we're at. But the one thing I'm seeing around town is I see a lot of people are starting to mask up, which is good. And we continue to hear, that it's people's right not to wear a mask. But at the same time, we're at a point where it's not a matter of us going backwards. It's not a matter of government telling us we're going to go backwards, because we are going backwards in a sense that I can tell you, I'll give you an example. There's a coffee shop not even 3 blocks away from here that stays busy all day long, but they can't staff it. So at 3 o'clock in the afternoon, it shuts down. And that's one of numerous businesses in town that are limited. There's a cell phone business I went to over the weekend that had 2 employees and 5 are out with COVID. And so businesses are naturally just slowing down and shutting down because they don't have the people to run them. So it's we're in serious times, and so people just need to do the right thing. And wearing a mask is not, in my opinion, is not asking too much. It's time. In my opinion, it's very much so time that people get them on. It's out of control right now, and as soon as I get the numbers, I'm going to share them with everybody as far as what the doctor has to say. But I just figured I'd open it up with that. We are doing things with the major chain stores, with the church groups. I don't agree with shutting businesses down a few hours early. And with that, I'll gather another thought or two, but Vice Mayor Lutz.
So I don't know who actually made the suggestion about closing bars and restaurants early, but I do know that that's what's happening in the Denver metropolitan area. And so maybe if we know somebody who has a contact down there that we could see, you know, like, do they have actual data basically proving that that change helped or worked, or is it just kind of arbitrary? Just because, I mean, you know, we have somebody in the region who's actually putting something like that into place. And so, you know, we could maybe reach out to them or have our health department reach out to them and see if they have statistics that back that up. Obviously, you know, things like the school district have nothing to do with us, and so we don't need to go into them. But, you know, the one thing I think that the city can honestly control the most would be, you know, not encouraging large gatherings. Obviously, you know, the city's involved with many different groups or events or things like that in city facilities. And so I know that last weekend the craft fair got closed. So that's a great example of, you know, what could have been. I mean, depending on, I'm sure they would have limited the amount of people who were allowed in at one time. But, you know, in past years, I would easily guess there's 1,000 people or more at one time at that craft fair. And so I think that that's probably the strongest way that the city can help these efforts is just reducing gatherings.
Councilman Hopkins.
Thank you, Mr. Mayor. I concur with your comments, but I will note that I have received letters that we're not wearing masks, but we are 6 feet apart or more. So that's the reason we allow that to happen. And I've been in several meetings the last few days, and it's very hard to understand what people say if you have a mask on. And so one of the things we did at a meeting this afternoon, we said, okay, if you have the floor, you can take your mask off and talk. And that makes it a lot easier to understand what's happening. In addition, like I said, I concur with the mayor's evaluation of our recommendations. And my first thought when I saw this was, if you don't have a mask on, you're not welcome here. Just no mask on, you're not welcome here. That's a little strong language. But that was my first thought. But I think if businesses had something along those lines, not necessarily saying it in that language, but we would appreciate you wearing masks because there are those in here who really can't stand to get the bug. Something like that. I mean, it could be a nice little contest for our school people to come up with in their classes, because the kids are wearing masks in classes, and I've gotten emails from people that say, oh, please don't make it mandatory, and they're sending their kids to school with a mandatory mask. And I just wonder what their thinking is when they send them to school and then they want to argue on the other side of it. So with that, I would just say that I think it's time that we bite the bullet and get her done. And I think, quite honestly, the governor's coming down on the side of that case. So thank you.
I'll go.
Hey, Mayor.
We'll go Councilman Councilman Powell, and then I'll come back to you.
And then was Councilman Pacheco?
Go ahead, yeah, and then Pacheco.
Well, as most of you know, I've actually been in favor of a mask mandate for some time now. And I think we're seeing the evidence now of our poor compliance with CDC recommendations that has been going on for months, despite all of our efforts to encourage people and point out the importance of following those guidelines. And I think the governor is under great pressure now to do a statewide mandate, and I suspect he probably will do that. Then the issue becomes, what do you do when someone doesn't comply with that? And asking some, 18, 19-year-old kid to tell someone at the Walmart entrance, "Sir, you can't come in because you don't have a mask on," they're getting paid $12 an hour. And they could literally be putting themselves in physical danger in those situations. And so I think part of what we should do, we're not the ones who are going to put a mandate in place, but we are going to have to decide, if a mandate is in place, what is our responsibility as a community to enforce that? People want to say, well, you just like telling people what to do. It's really about the next person coming in who's really at high risk and just wants to get some groceries and really shouldn't be around somebody that could potentially be infecting them. And we all know that masks aren't a guarantee, but clearly, if we had all been wearing masks back in March, we wouldn't be talking about COVID now. It would be gone. And so I think that's the discussion we should have. I am in favor of early closure. We've all been in bars after 10 o'clock, and people's judgment and capabilities to make sound decisions deteriorate over time. And so that does increase the risk of exposure. So I think these are very, very dangerous times, and I think we have to take some harsh measures. And I don't take any pleasure in it, but you can't even call it a curve. It's just going straight up. And we are now, I think, 5th in the country as far as deaths per capita, if I read the statistics correctly. So I think some strong measures are in order, and I think we should discuss, what are we going to do if a mandate is put in place statewide? Because obviously the state's not going to be enforcing that. That's on us.
Councilman Pacheco.
Yeah, my comments are just really quick. I think we're moving towards probably a statewide mandate that's probably coming down the pike at some point because it's just out of control. But I agree. I don't know how you control that, how you regulate it. I don't know. But I think we are at a moment now where we have to figure out what we're going to do. And I think we're moving towards that way, but how do we do that as a community with a little bit of reflection? Because there are people that are going to be upset that we're moving towards something like that that the governor's probably going to have to come down with. But as far as how I think the community needs to hopefully look at that and say, how do we do that for the best interest of everybody, especially the most vulnerable, the elderly, those with pre-existing conditions that are very susceptible to COVID. So I don't know, maybe I'm just opining. I'm just not sure how we move forward from this point, but I think it's going to have to come from the state.
Councilman Cathy.
Thank you, Mr. Mayor. I totally agree with you about the bar closures. The closing our bars at midnight versus the 2 o'clock, which would have been normal closing, versus the 4 o'clock in the surrounding counties, did nothing except force our business owners to lose business because the people went to the bars just like I sat here and said they would. So to close our bars at 10 o'clock, COVID doesn't know the difference between 10 o'clock, midnight, 2 o'clock, 4 o'clock. Just flat doesn't notice it, and we don't need to hammer our business owners any more than that. Secondly, I know the big push everywhere is mask, mask, mask. But if you do look at some of the other data besides what's put out by ABC and NBC and CNN, you will find that there are studies, one of them through the U.S. Marines, that actually split two groups, recruit groups, and that actually the masked group had a higher infection rate than the unmasked group. And also, these things are seasonal. Look at the normal flu. They go through about a 2 or a 3 or a 4-year cycle. They hit their peak in the winter in the northern hemisphere here. They die off in the summer. This is now the second wave of that. So again, if you look at some of the statistics, and I even forwarded you a copy of some of them today, that yes, the infection rate is going up, the death rate has leveled off nationwide. So people are getting infected, but we have come up with better treatments as well. And if we turn around and lock down this country, you are going to destroy America as we have known it, as our founding fathers designed it, as our veterans who gave all have died for the freedoms of this country. And we need to be careful that we don't head down this slippery slope to destroying one of the best countries on the planet. Thank you, Mr. Mayor.
Councilman Huber.
Thank you, Mr. Mayor. Nobody, let's be clear about this, nobody is talking about or proposing lockdowns and things like that. And Councilman Cathy, with all due respect to your comments and with my great friendship that I have for you, I think you're just, your statements are outlandish in that regard, and I don't think that they're constructive or moving the discussion forward. But having said that, you know, the question that occurs to me is, when all's said and done, and history is written and everything, do we want to be known as people who did everything that we could to try to protect ourselves and to try to protect our fellow man? Or do we want to be known as people that worried about other things? Oh, I might lose some money. Well, you want to talk about a negative economic impact. Economists have studied and studied and studied the plague in Europe for all the hundreds of years since that happened in every single one of those studies. And I learned this in undergraduate economics. Every one of those studies stands for the proposition that quarantine and prevention is cheaper in terms of economic impact than illness is. We're already seeing businesses that have too many of their people homesick, too many of their people quarantined, and they can't run for that. You know, I've been getting these emails about, oh, please don't torture our youth anymore by not having the ice rink fully open and things like that. Well, how the hell, what do you tell somebody when grandma, grandpa, or their uncle or someone else isn't going to be sitting there at the table? Not only not this Thanksgiving or Christmas, but always into the future. The impacts of that. You know, we need to keep these things in perspective. We are in a life and death emergency. This is a more contagious disease than the ordinary flu. You know, the numbers that we are seeing are just staggering. How many people, you know, when our infection rate gets to what? 10%, then are we going to start worrying? 20%, are we going to start worrying? 30%? You know, let's get going now. Well, you know, even Barney Fife was smart enough to say that you nip it in the bud. Well, we haven't nipped this in the bud, but we need to get going on this now and not sit around wringing our hands and citing isolated studies. You know, I had a friend just the other night that started talking about this study that I knew, and I said, no, wait a minute, that has been completely debunked. This idea that, well, 80% of the people that wear masks get sick. No, no. You know, and so we need to look at what the people who know what's going on with this stuff are recommending and follow those recommendations and get going. I looked at this list, I thought, you know, we need to pursue all of those things. And I think that we further need to sit there and, you know, do everything that we can think of at this point and then try to think of some more things to do. Because this is an emergency, it is impacting everybody, and the question is, do we try to get ahead of it, or do we just sit back and let it run over us and see, well, I guess that it was pretty bad. Those are my thoughts.
Go ahead.
Mr. Mayor.
Councilman Beach first, and then I'll come back to you.
Go ahead, let him respond.
I yelled at Councilman Kathy.
And I did not appreciate that, and you had no right to call me what you did. That is totally not right, Councilman Huber. I have my opinion, and I will speak my opinion.
Councilman Bates.
So normally I don't wear a mask because exactly what everybody said. We're 6 feet apart. But because I've had a cough from doing yard work, I decided to wear a mask today out of respect for everybody in this building. Do I wear it normally? No. Do I like it? No. So that's where I stand with that. So everybody's talking about, you know, we were asked what options, what is something we can do? How can we fix this? But nobody has given an absolute answer to it. So, but I threw out there, and I know that it was mentioned, there's no reason to go for it because it's not purview to us. But despite council has a little bit of leeway, especially when the mayor, the city manager meets with the health department, the school district, then whoever else, the doctors and everybody in the thing. I recommended, and some of it was left out, not sure why, but it's okay, that I think we should put pressure on the school to shut down from Thanksgiving break to the end of Christmas break, because it really started ramping when school started, right after school started. And for those that say, oh, our kids wear masks, I challenge every single one of you to go by an elementary school when they're out at recess and you count how many of those kids are wearing masks, playing with each other, messing with each other. Not very many of them. And I know it's outside, but they're interacting, and then they go in and wear a mask and that fixes it all? I don't think so. So that gives, from Thanksgiving break to Christmas break, that gives us over a month to see how the numbers would react or respond as far as for school. So many teachers are out. I read the Facebook pages regarding it. Take the SROs that we employ with the school district, and the businesses that want to require masks, have the SROs help enforce those people that aren't wearing masks. If it means a citation of the businesses that choose to enforce or require a mask, great. But the businesses that choose not to, as in the dollar store or the Dollar Tree or Sportsman's Warehouse or others that aren't requiring masks, leave them alone. If you don't want to shop there because they don't require masks, don't shop there. We've all said that. If you want to shop somewhere that requires a mask and it could be enforced, great. That helps protect everybody. When I go into Smith's, I respect them and I wear my mask as much as I hate it. But if I can get something at the dollar store or Dollar Tree instead of soda or whatever, I will go there because I don't have to wear a mask. I make that choice. The people can make the choice. The other side of it that I mentioned was to limit the amount of groups, events within the Hogadon and the event center, rec center, and so forth. Limit it. Now that's ours, and we can say when they have a sports there, maybe we could work with them, but saying only family, immediate family. I don't know. But I don't believe shutting down sports in any way, shape, or form helps our economy or helps anybody out as far as that goes. We could gather the data through all this time, and if at the end of Christmas break we see numbers still rise because we kind of slowed things down, then great. Let's do what we need to do. It also gives us a chance that time to have everybody think about what's the next option instead of jumping on a bandwagon and shutting everything down, or even looking at shutting it down part-time. That frame gives us a chance to make action plans. Here in the city, the county can, the school district can. It helps everybody out. Some of this here list did not show me solutions. And some of what was said didn't sound like solutions. There's some solutions. And the city, yes, we can't tell the school district or the county what to do, but I think we're on fairly good pages with one another. And if we all recommended it and pushed, I think they would be willing to hear us out at least. But that's my solution. That's what I think we should do. I accept any rebuttal.
Mr. Mayor.
Councilman Hopkins.
Thank you, Mr. Mayor. I shan't take long. All I can tell you, I'm going to give you some things that we have done for years. Many of us in this room have worked under OSHA rules and under MSHA rules. And the MSHA rules and OSHA rules are fairly consistent when it comes to you're going to wear safety glasses, you're going to wear a hard hat when you're in a construction area, you're going to wear hard-toed shoes, and you're going to have safety lines up, and you're going to have enclosed space rules when you have to have a rescue team ready to go, and you're going to wear masks in certain conditions. If it's dusty or has a hazard, you're going to wear a mask. I don't see a real issue. This is no different than the issues than when I worked under MSHA and OSHA for 30 years of my working life. You have to have these rules, and it does save lives, and I've got people that I've seen their eyes saved by wearing safety glasses. And it's just no big deal. We can handle it. Thank you.
Vice Mayor Lutz.
Just really quick, I think a lot of what's been said is completely and totally unrelated to what we're talking about. You can have your opinions. I mean, obviously, when you don't have, I don't think any of us, well, I mean, Charlie has a medical degree, but we also don't have laboratory research degrees. We're not here to discuss whether masks work or not, because that's not what City Council of Casper does. We're here to talk about what City Council can do to help be part of the solution and help fix a problem. And so I think that we need to refocus and talk about things that City Council can do versus opinions versus what's real and what's not.
Councilman Powell.
So I think Councilman Bates is correct that if we are going to offer something helpful, it really needs to be more specific. And so the idea of using the SROs, I guess I'd like to hear from the chief as to whether that would be feasible. But to me, at a minimum, we should be helping the public know where it's safe for them to go. And right now, those places that have signs saying masks required have no method in place to enforce that mandate, and people will literally walk right by that sign and not wear a mask. And we saw a couple weeks ago that we have a segment of our population that's very adamant about not only are masks not helpful, but they make you sick. And if people are listening to those things, then of course they're going to resist. But I guess I was wondering if it would be possible for us to use, if Walmart, for example, wanted to enforce a mask mandate so they could say to the public, if you come to our store, everybody's going to have a mask on. And rather than have that 18, 19-year-old kid try to enforce that, could we use our CARES money to pay for private security guards? I'm not joking, sir. Would that, rather than rely on our police force? Is that, I guess that's a question. Mr. City Manager, would that be a possible use of the CARES, again, so that we could tell members of the public, if you need to get some groceries or you need to get something, here's where it's safe for you to go today.
Councilman Powell, I'll answer that question. So I had a conversation along with City Manager Napier today with, again, with the Walmart Corporation itself. And, you know, their take on it is they have it listed, or they ask for people to wear masks in there, and they understand that some people aren't. But until there's a mandate from the state saying that people have to have a mask in public, they would prefer not to have law enforcement come in there and be the enforcement arm for them. They prefer that their customers, they ask their customers to be just that, courteous customers, and do as they ask and wear a mask while they're in the store. But until that mandate comes, and correct me if I'm wrong, Carter, but until that mandate comes from the state, they would prefer to just handle it on their own and not have law enforcement in there. Now, if that mandate does come, then they are more than willing to have our officers in there, although, and this is a discussion we have to have further with the chief, is we would prefer that, you know, if law enforcement's in there, last thing that we want to do is, and I'll go back to the analogy from 2 weeks ago, is the hospitals are inundated right now. They're short-staffed with nurses and with doctors. And they are seeing so many people right now with COVID that they're running out of room for everything. And heart attacks still happen, strokes still happen, everything medically still happens. It is no different with our police department than it is with healthcare workers. If we get to a point that we say, okay, well, now we're going to enforce a mask mandate, we're going to get phone calls that are going to say Citizen X is not wearing a mask, and this is where they're at. And I'm going to tell you, robberies still happen, sexual assaults still happen, homicides still happen. Our officers are busy as it is, and now to say, now you're the enforcers and you're going to go out and write tickets is, in my mind, ludicrous that we would even get to that point of doing that. What I'd prefer to see is if we have officers that are working Area 1 of Casper, which has Sam's Club and Walmart to it, and if they have downtime, to walk through there. And if somebody's not wearing their mask, ask them to do the right thing. Put your mask back on. The last thing I want to see is us getting tied up writing tickets. If it gets to that point, it has to be there, then I guess we'll cross that bridge when we get to it. But right now, that just, in my mind's eye, that just doesn't seem like that's not a feasible solution. Let me come right back to you, Councilman Huber. Councilman Johnson. And if I could, sir, this is not a public hearing, so when we get into the council meeting tonight, the citizen, you can make a comment at the citizens. Yeah, I'm just letting you know. I just don't want you to hold your arm up all night. I thought it started early. Nope. Councilman Johnson.
I was just going to say that we can't and shouldn't use the police force to enforce a company policy. If Walmart wants to trespass people from their store for not wearing a mask, that's one thing, but it is not the role of a government agency to enforce store policy or any private company policy at all.
Councilman Huber.
Thank you, Mr. Mayor. Councilman Johnson's exactly correct about that. If you want to talk about, well, we're going to have the police department go and enforce these kind of things, the only way that I can think of that would work is that, as Councilman Johnson just said, Walmart would have to tell people, do not enter our premises if you're not wearing a mask. You're subject to trespass prosecution if you violate this rule. And then if the person comes in there, then law enforcement could come in and cite them, charge them with trespassing. That would be a very cumbersome process to have to go through, but that's what you'd have to go through. It's not like you can just, as Councilman Johnson said, send the cops in there to enforce their rules any more than I could have a police officer come to my house and enforce the rules that I might want to impose on someone in my own home.
All right, I'd like to add just a couple more things, because I think that we're not really answering, we're answering questions, but not a lot of them that, so I guess I want to reiterate a couple of things, and I've received quite a few emails this week where people, well, over the last few weeks, where people are like, you have to mandate you have to get a masking mandate in place. I want everybody to understand that we don't do that. That's the county health doctors that do that. That's not city council. So for people to be upset at this body here for not doing it is not the place to put anger at. We can give recommendations to the county health, but county health is the one that actually requests that from the state, and the state has to sign off on it, being the Dr. Harris. She has to sign off on those orders. So I just wanted that to be clear out there. We have on here, to get with county health and Anna Kinder and her staff and get recommendations from them. Just so everybody knows, we have been in contact with Anna on a daily basis of everything that's going on, and we are working hand in hand and running with her recommendations. And we do, in fact, have, I can tell you at least one item right now of a non-compliance that's been in non-compliance for a long time that we're working on. And so those things are happening. Reiterate again, we're not trying to stop a virus, we're just simply trying to slow the virus down. And so when everybody's like, masks aren't going to stop it, no, but if masks slow it down, then we should look at that. As far as the city facilities go, I think that it's a good idea at this point in time that, and this is my opinion, everybody else can have theirs, and we can certainly decide which way to go, but I think that city facilities probably should be masking up. We've got too much sickness going on. And not to say that our city employee that we lost last week got COVID at work or wherever, but we just lost one. So I think that we should take that move and be a leader and mask our people up throughout our facilities. And the same thing with, we talked about the rec center too. To go back to stores like Walmart, and I'll reiterate the same thing I said like 2 months ago. If you don't want to wear a mask in any of these stores that ask you to wear a mask, if they have an online option, use the online option. You don't have to go in there. You don't have to put a mask on and go inside. You have options, and so people need to use that. And the only other thing I would really add is that, yeah, I get it. Flu season, there's, people get sick. Totally get it. Except for we haven't quite reached flu season yet, and COVID has taken over this community right now. It has inundated the hospital and stretched them beyond belief. And we haven't even got the flu season yet. We haven't even got the sickness from flu there yet. And so whatever we need to do, we need to get this under control. And lastly, we're talking about masks here tonight, and we're actually talking about what we need to do to slow this virus down. It's not all about masking. It comes back to doing the right thing. If you're sick, don't go to work. Wash your hands. All the stuff we've been saying for the last 8 months or however long this pandemic's been going on, it's the exact same stuff that we've been saying. It is not just centered around masks. It is centered around doing the right thing, and let's slow this thing down. Will the governor make it mandatory? I don't know. Stay tuned. I'm sure we'll find out by the end of the week. But in the meantime, we need to do what's right. And if there's a sign on the door that says put a mask on, then put one on. It's not that hard. We're not taking anybody's rights away. And I don't want to go backwards, because in my opinion, we go backwards and we end up shutting things down, then we are going back to where we're taking people's rights away. So put on the mask where you still have the right to move around and do what you need to do, and we can all move forward. That's about all I got left to say on that. Anybody else have anything to add? All right, Mr. City Manager, you got Do you want direction on this, or?
Mr. Mayor, if council does have direction with regard to elements of this, list of a variety of proposals, I'd certainly take it. If none of that's available, I understand, and if we need to have another conversation, we can certainly do that too.
Councilman Johnson?
I think as far as requiring masks in city facilities, I would leave that up to the city manager's discretion to decide.
Does everybody agree with that? Okay. And I'll come back down on this list, and I'm sure I'll probably get, some of you won't agree with it, but I'm going to come back to the bars and restaurants at closing at 10 o'clock. I just don't think that that's our place to do that. This virus doesn't have a watch, doesn't tell time. It does not tell time. So it is not going to sit there and go, well, it's 10:01, it's time for us to go infect somebody. So to me, that needs to come off of there altogether. And if you think it's that big of a deal, then it's either stay open or close them. And I'm wholeheartedly against closing anything. Businesses cannot afford to be closed. So that's my opinion on that. Councilman Huber.
Thank you, Mr. Mayor. I think that what is, I'm hoping that what was being looked for there is the idea that, after 10 o'clock, people that are still there probably have been drinking and partying for a while. The inhibitions are down. They're not, they're not being as careful as they might have been earlier. They're, every bit of data that I've seen stands for the proposition that if you get loud and boisterous, that you're spewing out more droplets than if you're using your quiet inside church-like voice. And I think that's what they're looking at. I agree with what people are saying, that just arbitrarily saying, well, you can't stay open past this time. That's like any other arbitrary break-off point. If we want to encourage servers and that to try to, could you folks please quiet it down over here, but I can just picture how that's going to work. And I think it's all about trying to reduce and eliminate as much risky behavior as you can. I think that closing them at 10 o'clock is a completely reasonable thing. And as far as if other communities don't want to try to do anything to keep people safe, that's on them. I want to have Casper be out there in the lead, trying to make our community as safe as it can and do everything that we can.
Councilman Bates.
Thank you, Mayor. I agree with you. If a bar, restaurant, whatever wants to close early, they have that right to choose to close any time that they want if they feel that it'll help with COVID. If they choose not to, that's, I think that's fair and reasonable. So I agree with you. I don't support that.
The only thing I would add is when we go back to talk about schools, obviously we don't control them. And so as far as the schools deciding to stay closed through the breaks, that's up to them. But I will say Casper College and University of Wyoming both this week have decided that they are going online for the duration of the semester. So that's been done at the collegiate level. So as far as whether it happens here, that again is not up to us. That comes back in line with just like we don't mandate masks. We don't mandate what the school district does. That's entirely up to them. Is there anybody else that has anything else on this? Okay, Mr. City Manager, anything else? No. Okay. Do you have anything on agenda review?
No, sir.
Okay. Guess we could just jump right into the meeting then, right?
Let's have a meeting.
All right. Before we begin this evening, I'd like to remind everyone to silence their cell phones at this time, and I now call the November 17th, 2020 regular council meeting to order. All members are present. Chair would entertain a motion, no, never mind. Council meetings are also televised and can be viewed on cable channel 192. Would you please join me in the Pledge of Allegiance? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Chair would entertain a motion to approve by minute action the minutes of the October 31st, 2020 special council meeting as published in the Casper Star Tribune on November 7th, 2020.
So moved.
Second.
Moved by Councilman Hopkins, second by Councilman Bates. Any amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
Aye. Motion passed.
The chair would entertain a motion to approve by minute action the minutes of the November 3rd, 2020 regular council meeting as published in the Casper Star Tribune on November 8th, 2020.
So moved.
Second.
Moved by Councilman Bates, second by Councilman Johnson. Any amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote. The chair would entertain a motion to approve by minute action the minutes of the November 10th, 2020 special council meeting as published in the Casper Star Tribune on November 15th, 2020.
So moved.
Second.
Moved by Councilman Bates, second by Councilman Johnson. Any abstention or any amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
With all members voting aye, motion passed.
Chair would entertain a motion to approve by minute action the minutes of the November 10th, 2020 executive session.
So moved.
Moved by Vice Mayor Lutz, second by Councilman Cathy. Any amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
All members voting aye, motion passed.
Chair would entertain a motion to approve by minute action the November 17th, 2020 bills and claims as audited by City Manager Napier.
So moved.
Second.
Moved by Councilman Hopkins, second by Councilman Bates. Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
With all members voting aye, motion passed.
Now is the time we invite anyone in the audience who wishes to speak with council to come forward. As stated on the first page of the agenda, we ask the following. Please state your name and address. Direct all questions, comments to the mayor and only the mayor. No personal attacks on staff or council will be tolerated. Council will not respond to personnel matters. These will be referred to the city manager. Questions posed by speakers may or may not be responded to by council members. Presentations are limited to 5 minutes, and duplication of speakers will not be allowed, nor will time extensions be permitted. Please note that public hearings and ordinances have their own comment period. Please hold your comment on those items until we've reached them. Sir, now you can come up.
Michael W. Hamill, Mayor, 2504 Bonnie Bray Street. I've been sitting here listening, and it just seems like, I'm just wondering if I'm sorry, men and women, are thinking about something like you brought up the fact about the hospital being so overwhelmed. Why don't you establish some triage centers around town that will separate minor injuries from the people who need to be at the hospital? You might relieve a lot of emergency room population there, sir. The gentleman's comment about, like I said before, you're not going to stop it now. It's too late. Senator Anderson had the opportunity back in February to take action. He refused to do so. The thing about the bars, if you start shutting down the bars, you're going to encourage DUI. That's all there is to it. They're going to go to the liquor store, they're going to buy a bottle or a six-pack, they're going to open it and have a drink on the way home. Now you got other issues. I don't disagree with some of the things I've heard here. But may I make a couple of suggestions with no insult intended, Mayor Friel? Things that you're bringing out from your closed-door sessions, you need to be more open about that. We are not as stupid and ignorant as y'all may believe. I can't say, you can't jump with every phone call you get. And I understand, people are frustrated, people are angry, that's gonna get worse. You can't stop it now. The only thing you're gonna slow down by imposing stay at home, and I don't argue with the mask, it's a good idea, but you should be wearing face shields too, because if you talk to one of your infectious epidemiologists, you'll find out 6 feet is only a third of the distance that a sneeze or cough can travel. I don't know. I wear a mask because my wife is immunocompromised. But I'm not going to lock myself in the home at anybody's orders. I don't care who it is. I'm not going to become a recluse because of this. I am not going to close my eyes and not watch what's going on around my city. And neither are the rest of us. You've made people angry. You are. When you sent the doctors up on that stage at that emergency meeting, you folks shouldn't have been there. Americans have developed a very negative attitude towards our politicians. Because all we see is we see them taking and taking and taking. We see our property taxes go up every year, a major jump this last year from an arbitrary increase over the decades previous that Mr. Keating put off as a clerical error or misjudgment or something. You guys want to show the people out there that you're serious about them, that your comments about us as stupid, ignorant, well, let's just say people. Why don't you all step up? I don't have much money. I'm a disabled veteran. I live on my disability. When I heard that there were people hungry out here and that the mission is doing everything they can to help feed, what, 300 families? I did a little something. All I could do with what little I had. Here's a perception from us. The City Council, the Natrona County Board of Commissioners, they demand our property taxes, and I know you guys, I don't think you guys are responsible for that. I think that's a county assessors and Natrona County Commissioner thing, okay? But please understand, we know that you receive emoluments from a portion of those taxes. Step up. Put some of that taxpayers' money out of your wallets and go.
30 seconds.
I'm not making an insult, sir. Go make a visible effort to show people that you'll do something on your own. As a lawful American, as an individual, step up. Please. Because you're not going to stop this. And think about the triage stations. I'm done, sir. Y'all have a nice night. See you next meeting.
Vice Mayor Lutz.
So just to reiterate, because this is multiple meetings now that we've had to reiterate this body does not have closed door sessions ever. The only time we meet as a group are right here in front of all of you. It's recorded. You can watch it on the television. You can watch it on YouTube. I'm not really sure why we have to keep reiterating this. We are not having closed door sessions. That's not a thing. Obviously, I would like to have asked him why he has that perception, but he left. He kind of touched base on it. Just a reminder, we have nothing to do with property taxes. I also don't think anyone on this council has ever referred to any citizen as stupid or ignorant, so I'm not sure what those comments about, but I just want to reiterate that. And as far as assuming that none of us are stepping up personally or individually, I think is very unfair, especially without talking to any of us, because I would go ahead and imagine that every single person here is stepping up personally and individually to help out this community. So a lot of misinformation there. Just want to turn it back around and talk about what's actually true and factual.
Good evening. Mr. Laird.
Mr. Mayor, members of the City Council, Mr. City Manager, Mr. City Attorney. Personally, I think you're doing a fine job, a great job, and I do know we have angry citizens. And so that isn't why I'm here, but it was interesting to listen to that because that gentleman did the best he could, I believe, with what he was saying. But it's a very, this is a job that you all have. As you know, it isn't easy. And most people don't know how you finance anything through the city and where you get your money or any of that. And then they leave, they don't want to hear the answer. But I think you're doing a good job. I think most citizens think you're doing a good job. So here's where I'm at. I decided, I don't know why, it came to me one night because I lived over on Wilson Street by the hospital, and there's a park called Conwell Park. My grandmother used to take me there when I was in 5th grade, when I went to Willard School. And she just sat there very quietly, and years later said she would pray there. She just felt good there. It was across from the hospital, and she went there when somebody was in the hospital, and she'd wave at them up in the windows. And so I've thought about that over the years because I was on the hospital board, and at one time I thought maybe the city ought to partner up with the hospital and do something with that park. And due to politics, it just didn't happen. So I put on Facebook recently, what would you all think, all the Casper people? I have like 4,500 friends or something on Facebook. If the name of Conwell Park was changed to, first of all, I thought the Prayer Park, and I thought, nah, that'll have other issues. But what about the Healing Park? So I put it out on Facebook, and it was amazing, the comments I've had. Probably 1,500 comments and people sharing it. I had one person said, well, what about naming it Serenity Park? Another one said, why change it at all? But almost virtually everybody said that would really be a great idea. Now, why would they say that? And why would I come up with this idea? And I think it's in the air. It's time for a change. And I think that gentleman that here was earlier, I don't want to pick his brain or think about what he really said, but what I think he was saying underneath all of his words was, we look to the city government, to our city council members, not just to pass a few ordinances, not just to manage some money, but you're the leaders of the community. A lot of people go out and vote for you. And I think they want to hear healing things from you in these times of need. And I just would like you to think about that. You know, there's some of you I served here with, and I really still appreciate to this day those of you who voted for me to get on the council, because for me it was a great experience. But I reviewed your methodology on changing the name, and I don't think I really want to completely change the name. Carter and I have had a couple conversations, and so I put out a suggestion, which I think was a great one, which is, what about the Healing Park at Conwell? It just gives people, certain people in this community, a feeling of something that is hard to explain internally. I just feel really nice when I hear that name. It doesn't have a religious name to it. I don't think Mr. Conwell, who donated a $20 piece of ground back in the early 1900s, is going to mind if somebody called it a healing park. He probably would like it. But it was so overwhelming from the comments for people who do want to go up there, and they can't, now we can't get in the hospital to see our loved ones. My partner of 36 years passed away last Saturday. I've known him since he was a child. And this virus is serious, serious business. And we need to take care of each other. The only reason I wear the mask, I don't want to give something to somebody else. And it's the best thing I know how to do it. I've been tested twice. My fiance's been tested 5 times because she works in a healthcare facility. 7 times, we've had 7 negatives. We had her daughter, who's 17, come up with the virus. And fortunately, we have a place out and back where she could stay in our little guest house, and we avoided that contamination. And so, Mr. Mayor, your words are right on the money about that. But this healing park will be something when people just drive by that hospital, because the hospital is a healing place, but it's a dying place as well. To just see the word healing day in and day out, it gets into people's consciousness. It's kind of a little piece of advertisement to give them a thought when they drive by their car, when they walk over there, when they go over there to say hello. When they had the big deal for Officer Carlson, his family members, and you know this, it helped them heal when 500 or 600 people showed up there. But we got to involve. I think we have to involve our spirituality to defeat this as well. And I'm hoping you'll really consider doing this. I've offered to pay for the sign. I don't want a name. I don't want anything for myself, other than I think it gives something to the community on what might be a really huge basis, but a very sort of spiritual basis. So I'm asking you to consider that, and I'd like to see you do it as quickly as you can. And I'm not hung up on the name, but I liked what my conversation with Carter revealed, which was the Healing Park at Conwell. Doesn't really require a big name change. I'll pay for the sign. And I can tell you the people on my Facebook page said things I hadn't even thought of about what that would mean to them to be able to have that in our community, because I've seen it in other communities, and you're looking for something, it's just a little thing. People can make different kinds of statements and arguments, but the truth is you can do a resolution pretty quickly, and it's going to be a lovely thing for this city, I believe. And so I don't envy you your job. One thing I will comment on is the city manager deciding whether to do this in this building with masks. I really think the people voted you all in to take a vote on that, to know where you all stand, because it's a healing thing. And many people are counting on you, as you said, Mayor, to do the right thing and not take a step backwards. But I'm proud to be here because I know how hard you all work and how you think, and you're all smart people and you understand this. But it's very difficult to get it out to members of the public about what underlies everything. And I understand having a meeting that the law requires you to have without being here in the public, because we were involved in several of those, but the law requires it. You follow the law. I know you follow the law. And this time I'm asking you to follow your hearts. Thank you very much.
Thank you, Dallas, and sorry for your loss. Councilman Heber.
Thank you, Mr. Mayor. Dallas, don't run away. I got a question for you, but also a comment. I really share your deep grief at losing John. He's a great guy and someone who died far too young. And in part, that kind of loss is part of why I'm as passionate about these things as I am, and my passions do sometimes overtake me. But what would you think, and what do you think that your people would think if that name was still, if it was at Conwell Park, a place for healing? Do you think that would do the same thing? Or and I'm just asking. I want healing in there somewhere. Yeah. Uh huh.
I know you'll make the right decision.
Well, I don't know that I have that same confidence in me to make the right decision, but.
You want to know? Was the Healing Park. End of story.
Yeah.
And so I'm not picky.
No, that, and I just,
Get it done, and I know you all have come up with some good ideas. I want people to be able to drive by there. I'm sorry.
no,
I can't drive by there without thinking about John. Sorry about that. And this thing's real. And if you have to shut down bars at 10, it's fine with me, if it really helps. I don't know whether it does or doesn't. I'm not a scientist. But you're on the right track, Councilman Huber. Give the community something healing. Because they're all in pain.
well, many of us are.
Was in pain. I'm sorry it's too soon for me. I don't mean to do this.
Oh, well, we totally, absolutely understand and share your feelings, Dallas, believe me.
Thank you very much.
Well, thank you, and you hang in there now.
Mr. City Manager, what does it take in order to do something like that? Because I have to agree that, on that park in particular, you're right across from a hospital, and he brings up a very good point that I was sitting here thinking myself is, you know, where did everybody gather when Officer Carlson got shot? They were right there in that park. Where were they holding the signs up? Right there in that park. Where do people go when people get sick and they want to take a break or whatever it might be from the hospital, but still be there, right there in that park? So I agree 100% with what he's saying. So I guess my question is, what does it take in order for us to make a change like that?
Mr. Mayor, I think it's just a simple resolution that effectively changes the name, doesn't have to be too wordy, and I think it's one motion.
Is that a motion that we can make tonight to move forward on doing something like that, or what do we need to do to make that happen?
What I would recommend is council would, effectively give me provisional direction to prepare a resolution for formal consideration, then we'd bring it back maybe the first meeting in December and have you vote on it formally.
So can we do that with a thumbs up now, or?
I think so, yeah.
Okay.
We'll prepare a resolution. Thank you.
Thank you.
Good evening, Kyle Gamroth, 6907 Columbia River Road. Mayor Friel, City Council, City Manager Napier, City Attorney Henley. I'm sure it's information that probably would have been useful in your previous special meeting, but I just wanted to make sure you guys were aware, in case it informs any further discussion this evening, that Natrona County did pass a mask mandate. State officials approved it today, and it could go into effect as early as tomorrow. So I just wanted to make sure you guys were aware of that, in case you have further discussion. Thanks.
Thank you, Kyle.
Mayor, City Council, I just wanted to make sure that you were aware. Well, a couple things. One of the things that strikes me about the park with Mr. Laird is, I think it's called Conwell Park now. So I just want to make sure that we're not doing a disservice to whoever Conwell is. Somebody gave consideration to name that park after somebody named Conwell or his family. And so I just want to make sure that we're giving that family or that person consideration before we just change the name. Maybe we can keep that name and add the healing place like Mr. Huber had mentioned, but I just think a little research should be done before we just change the name and make sure we're not offending a family or a person that earned that distinction or that honor for that park.
If I could just respond to that, I think that's what Dallas was asking, was that it remains as Conwell Park. He just wants the word healing in there somewhere, and I think that's exactly what we're planning on doing.
Excellent. Excellent. Yep. And then lastly, I just wanted to make sure, I don't know if you were aware, but the GOP today, their Central Committee, passed a resolution actually asking for the governor to drop his statewide mandate. So, and that's coming straight out of the GOP party. It was passed today. So even though the county just apparently put in a mask mandate, the GOP is asking the governor to do away with his mandate. Now, just as a personal opinion, I do want to share with you, when my son had cancer at 12 years old, And then he got shingles. He was extremely immune compromised. We had to put a mask on and a gown anytime we wanted to go in his room. And I think part of the problem is, and I know that you folks don't mandate masks, but I know our county just did, and I know our governor may, with or without this. The problem I see is, and people have their rights, but there's a humanitarian aspect where we need to take care of our people, and I do understand that. But people don't have to go out. You can call and get groceries delivered to you. You can get just about anything you want without ever leaving your house. So if you're sick or you're immune compromised, my suggestion is you stay home. Asking everyone else to wear a mask, asking a business owner who owns a bar or a restaurant to close early is ridiculous. You have no right to get in their pocketbooks, as far as I'm concerned, and I don't think that's fair. So I just ask you to please consider those points when you folks make decisions on getting into someone's private business and their private finances. I think that's going a little too far. So thank you very much for hearing me out.
Thank you. Councilman Johnson.
I just want to clarify, isn't that mandate that the county enacted, it's just for county buildings? I don't think it's a county-wide mask mandate. It was for a county-wide for all the people in Natrona County. Okay, because I saw something about it, but it was just for county buildings.
Mayor, can I please just ask one more question?
Yes, sir.
Thank you. I'm just curious if the police chief is here, so I'm curious what their role is going to be. With a countywide mask mandate, are they gonna write tickets for people that aren't wearing their masks downtown? I'm curious. What are the teeth in it?
I won't be able to answer that for you right now, and I really would not want to put the chief on the spot at the moment until we're able to actually read this order. And Kyle is correct. I do have an email from Anna saying that a mask order has been approved at the state level by the AG's office, and it is awaiting Dr. Dow's signature. I have it. I don't, obviously, it's going to take a bit to read it and see what all is in it, so. Is there anyone else that wanted to speak to council? Okay. Please read the consent agenda titles.
Establishing December 1st, 2020 as the public hearing date for consideration of the following 4 items. Item 9A1A, an ordinance amending Chapter 9.40 of the Casper Municipal Code, offenses by or against minors. Article 4, sale of tobacco. Item 9B1, terms of the sale and transfer of ownership of the real property generally known as the former Beverly Street Ballfields property. Item 9A1C, the transfer of ownership for retail liquor license number 11 from Party Time Inc., doing business as Party Time Liquors, to JJBB LLC, doing business as Party Time Liquors. And item 9A1D, the transfer of ownership for retail liquor license number 17, L&L Liquors Inc., doing business as Liquor Shed, located at 4241 East 2nd Street.
The chair would entertain a motion to by minute action to establish the public hearing dates just read.
So moved.
Second.
Moved by Councilman Cathy, second by Councilman Hopkins. Any abstention or nay votes? All voting aye.
Aye.
Aye. With all members voting aye, motion passed.
I now declare the public hearing open for the consideration of the zone changes of lots 3 and number 4, Hembry addition number 2. Mr. City Attorney, do you have any exhibits?
Thank you, Mayor. We have 2 exhibits. Exhibit number 1, correspondence from Liz Becker to J. Carter Napier, dated November 13, 2020. Exhibit number 2, affidavit of publication, is published in the Casper Star Tribune, dated November 2, 2020.
Mr. City Manager, do you have a report?
Thank you, Mr. Mayor. I do. We'll have an exhibit here that we'll pull up on the screen for you to follow along with the deliberation here. These 2 lots in the Hembry addition number 2 are located on the east side of Robertson Road as it traverses the Green Valley Mobile Home Park there. on the west side of our community. I noticed that some of the historical uses of this property, particularly when it was located in the county, are very much along the lines of what the petitioner would like to do with respect to the pieces of property that necessitate this rezoning. And back in those days, it was used for a drive-in sort of coffee stop serviced by a small structure, which is similar to what we understand the location, or excuse me, the rezone would allow to have happen. And that, in fact, is moving from an R2 one-unit residential to a C2 general business. The Planning Commission did vote to support this and would seek your favorable approval this evening as well.
All right, thank you. Council will now listen to public comment. Public hearing comments are limited to 5 minutes and no duplication of speakers will be allowed. At this time, I'd ask those individuals who wish to speak in favor of the issues involving the zone change of lots 3 and 4, Hembry Addition number 2, please approach the lectern.
Hello, I'm Jim Roberts. I'm actually the one that is asking for the rezoning. I really do appreciate the City Council's time today. I also would like to see something done with the park there by the hospital. I got to say that that's been a place we've spent a lot of time at and hung out at, and sure is pretty at Christmas time too. So I do want to kind of go through some background and history on the property itself. I know you do have the map up there. So before 2000, it was zoned agricultural, and it included an adjacent home and a grandfathered asphalt trucking business. So that actual lot wasn't really used for a home site at that time. And then in 2000, it was zoned agricultural. 2009, it was still zoned agricultural, but it included the replat of the Hembry Addition with conditional use permit for warehousing and light industrial use. So even at that time, it was still kind of used more for a business. In 2016, they created the Hembry Addition number 2, which included the subject property, and that's when it got changed to R2. So just kind of looking at 2016 to present, it's remained a paved parking lot with a storage building. I think it's up there on the north side there, and until it was sold to the present owners, which are us. So just some justifications for our zone change that we presented at the Planning and Zoning Commission. Was it historically required conditional use permits to operate various businesses? So once again, if we still kept it as C2, we'd have to go through another conditional use permit. And we kind of feel like just getting it changed to R2 will just simplify things. Property has not been used for residential use. And the acreage, the property boundary, the shape, the setback restraints, easements, and normal traffic, it just doesn't lend itself well to a single family dwelling. So we think this is like a perfect use for it. It also, just a small commercial development in that area. I mean, I know it's just going to be a drive-through coffee shop. That's what we're talking about right now. And I'll probably get some use out of that storage building there. But beyond that, we don't plan a whole lot more at this time. But I know one of the things we talked about before was just the river interaction there, that it's in that particular area, there just really isn't anything in that particular neighborhood for, kids or families to just kind of hang out and have a beverage or, coffee or whatever. We are aware that the trail extension is going to be going right by there, so it'll be a kind of a nice place for people to stop and hang out and rest. It also provides an opportunity in that area that doesn't have any kind of businesses for a small business, kind of enhances the neighborhood, provides some public places for people that they can gather. And, the one big thing is it embraces the river. I think everybody really loves the river and the trail system and everything. And we'd like this to kind of be an integral part of that along with the neighborhood. So that's kind of our justification for the zone change, but I'd be happy to answer any questions.
Does anybody have any questions? Councilman Bates.
Comment and a question. Thank you, Mayor. One is, I think it's fantastic, and one of my questions was going to be how you felt about the bridge being put directly next to you. So I'm glad that you're all in favor for that and willing to take that on. With that property, do you own right to the river, or does it sit back a bit from the river?
It sets back a little bit from the river. I think the city kind of owns the bank. Probably
bank
like
part.
high water mark or something.
I was just wondering if there was a way to, a lot of people do boating and stuff, and to do where they could pull off their boat or something within that area and come up and get a drink or something. I think that would be kind of a neat thing, because I totally support this. So,
Right.
But anyways, I just wasn't sure if you owned to the river and thought about that or not.
We've thought about it, and I think, everybody seems like they really like the idea and stuff, and hopefully the city would work with us on something like that. But, right now we're just working on the plans for a drive-through. But, no, that would really be great for the river traffic. I mean, they could just stop there and hang out and have a drink, and we're going to have coffee and beverages there, and maybe some, quick food products too, but, possible expansion down the road, but that's all we're looking at right now.
Nice.
But yeah, we'd love it if people could tie off, their kayak or raft or canoe and.
Councilman Huber.
Thank you, Mr. Mayor. Sir, could you refresh my memory? Where's that footbridge going to be along there?
Well, it's kind of interesting you asked that question. So right now where it's planning on going is, about, see that little north lot there? That was actually part of the Hembry addition. And
The one that says owner City of Casper?
Right.
Yeah, okay.
So right now they're planning on landing it there. I have talked to somebody that's involved in the trail system, and they've been discussing the possibility of maybe coming in at a different angle. It may be tough for us. We'd love to help out, but we're kind of restricted on that property. It's, you only got so much room there for a drive-through.
Well, and that riverbank there's kind of steep, if I remember, isn't it?
Yeah, it's pretty steep in spots.
Okay.
Yeah.
Thank you. I was just trying to remember where that was going to be.
Right. I know on the other side of the river, there's a power line there and stuff, and that's the difficulty they're having with the trail extension, is kind of working through that, from my understanding.
Mr. Mayor, just another
Councilman Powell.
question for you, sir, but for Councilman Huber, part of this bridge should be named after Councilman Hopkins, who came up with this idea. And I don't know that this would have ever been considered if he hadn't proposed it.
Okay, thank you, sir. Could we get your address just for the record?
I'm sorry. It's my name's Jim Roberts, and I live at 2235 Mercy Circle in Casper.
Okay, thank you, sir.
Thank you.
Is there anyone else who wishes to speak in favor of the issues involving the zone change of lots 3 and 4 Hembry addition? Okay, at this time, I would ask those individuals who wish to speak in opposition to the issues involving the zone change of lots 3 and 4 Hembry addition number 2, please approach the lectern. Okay, there being no others to speak for or against the issues involving the zone change of lots 3 and 4 Hembry addition number 2, I now declare the public hearing closed. Please read the ordinance by title only.
Ordinance approving a zone change of lots 3 and 4, Hembry Addition Number 2 in the city of Casper, Wyoming.
The chair would entertain a motion to approve on first reading the ordinance just read.
So moved.
Second.
Moved by Councilman Bates, second by Councilman Hopkins. Discussion. Okay, no discussion. Any amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
All members voting aye, motion carries.
I now declare the public hearing open for the consideration of Mesa del Sol 4 edition. Mr. City Attorney, do you have any exhibits?
Thank you, Mayor. Two exhibits. Exhibit number 1, correspondence from Liz Becker to J. Carter Napier dated November 13, 2020. And exhibit number 2, affidavit of publication, is published in the Casper Star Tribune dated November 2, 2020.
Mr. City Manager, do you have a report?
I do, Mr. Mayor, members of the council. As you can see here on your video exhibit, that indeed the area in question, in fact currently known as Mesa 3, has this platting and characteristic in place, albeit undeveloped, that many of you may even be familiar with. The plat in question actually vacates the proposals that I just showed you to what is being considered here, wherein those vacations would take place and 2 lots would be then created to make up the Mesa 4 addition, and would actually, of this 12 acres, create, as I mentioned, 2 lots. If you look here very closely, that second lot, where I've got that underline, is where that new lot, I guess, would be put in place. This is that area where there's been some question as to what is in that area there underground, to give you sort of a feel for what we're talking about. With respect to the Planning Commission's deliberation on this matter, they did vote unanimously to support this new plat and therefore potentially a new development within our community.
All right, council will now listen to public comment. Public hearing comments are limited to 5 minutes and no duplication of speakers will be allowed. At this time, I'd ask those individuals who wish to speak in favor of the issues involving Mesa del Sol 4 edition, please approach the lectern.
Good evening. Bill Faringer with CEPI, 6080 Enterprise Drive, representing the owners of Mesa del Sol 4, as they are out of the state right now. But as you can see, that there were they had this whole area subdivided originally into lots and blocks and streets and parcels, and since they've had some issues up there with structures and whatever, these current owners would prefer not to move forward with developing of this, so they wanted to kind of clear the slate, clear the board, and then probably try to see if somebody's interested in purchasing it for developing it on their own. So that's the reason for this replat. The street that you see in there that creates the large parcel and the small parcel is strictly in there to take care of, there's an existing water line in there already, and that's the reason for that street that follows that water line. And so that still gives public access and everything for that existing city water line. So if you have any questions, I'd be happy to answer.
Anybody have any questions of Mr. Faringer? Okay, thank you.
Thank you very much.
Is there anyone else wishing to speak in favor of? Okay, at this time, I'd ask those individuals who wish to speak in opposition to the issues involving Mesa del Sol 4 edition, please approach the lectern. All right, there being no others to speak for or against the issues involving Mesa del Sol 4 edition, I now declare the public hearing closed. Please read the ordinance by title only.
An ordinance approving the Mesa del Sol 4 subdivision agreement and the vacation and replat creating Mesa del Sol 4 edition.
The chair would entertain a motion to approve on first reading the ordinance just read.
So moved.
Second.
Moved by Councilman Johnson, second by Councilman Bates. Discussion? Any amendments? Any abstention or nay votes? All voting aye?
Aye.
Please record the vote.
All members voting aye, motion passed.
I now declare the public hearing open for the consideration of Kinko Edition Number 2. Mr. City Attorney, do you have any exhibits?
Thank you, Mayor. Exhibit number 1, correspondence from Liz Becker to J. Carter Napier, dated November 13, 2020. And exhibit number 2, affidavit of publication, is published in the Casper Star Tribune, dated November 2, 2020.
Mr. City Manager, your report.
Thank you, Mr. Mayor. With respect to the area in question, we have an aerial view of the property being discussed as outlined in the blue marking here. This area, this particular addition, is a part of what we call Block 44, which at one point in time the virtues of Block 44 were vacated, and for whatever reason this particular area remained unplatted. The petitioner would like to erect a commercial building in addition to the commercial structures that exist on the area in question, again, which is marked in blue in the general area of North Elma, north of the interstate, and therefore necessitating a plat to be created to restore some virtues to the at least this portion of the block. Consequently, the ordinance being discussed this evening approves said plat, much like what you see here, and allowing for this development to take place, if approved.
All right. Council will now listen to public comment. Public hearing comments are limited to 5 minutes, and no duplication of speakers will be allowed. At this time, I'd ask those individuals who wish to speak in favor of the issues involving Kinko Edition Number 2, please approach the lectern.
Good evening. I'm Wade Kendall, 296 Van Horn Avenue, and I'm the one that's wanting to create the new building. The new building will actually clean up the existing area. We had a pretty big storage yard there with a bunch of stuff on it, and we're looking at putting up a shop that will be separated into 3 little shops for working on like cars and privately owned businesses. So I think it would be a good for the city as far as cleaning up the back of the ballparks with a new building, and also just cleaning up the area and, you know, doing something good with the land that's already there.
Okay, any questions for Mr. Kendall? All right. Thanks, sir.
Thank you.
Is there anyone else wishing to speak in favor of the issues involving Kinko Edition Number 2? All right, at this time, I'd ask those individuals who wish to speak in opposition to the issues involving Kinko Edition Number 2, please approach the lectern. All right, there being no others to speak for or against the issues involving Kinko Edition Number 2, I now declare the public hearing closed. Please read the ordinance by title only.
An ordinance approving the Kinko Edition Number 2 subdivision agreement and the final plat creating Kinko Edition Number 2.
Chair would entertain a motion to approve on first reading the ordinance just read.
So move.
Second.
Moved by Councilman Johnson, second by Vice Mayor Lutz. Any discussion? Councilman Bates.
I may have missed it. Carter, I'm assuming that planning and zoning's all for this, and I may have missed that you said that they were, so I apologize.
Mr. Mayor, Councilman Bates, I actually don't think I mentioned that, and indeed they do approve and would suggest your approval as well.
Okay, thank you.
Any further discussion? Any amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
All members voting aye, motion passed.
I now declare the public hearing open for the consideration of the amendment to the source gas franchise. Mr. City Attorney, do you have any exhibits?
Thank you, Mayor. One exhibit, exhibit number 1, correspondence from John Henley to G. Carter Napier, dated November 5, 2020.
Mr. City Manager, your report.
Thank you, Mr. Mayor. we are in the position where the current franchise with our partners at Black Hills Wyoming Gas is nearing expiration, if you will. And so we have come together and worked through some questions and so forth, and determined that the best course of action with respect to this franchise would be to simply extend this franchise for another 20 years without any real substantive changes to burden the deliberation with. As typical to a number of conversations of this nature and deliberations, we tend to get questions about what this means for those in the service area and impacts to their bills and so on. And in the fact that we are simply extending this for another 20 years, there really isn't going to be any increase as it relates to impacts for our residential customers here, again, in our community, our service area. And so that those impacts aren't going up, but they aren't going down either as it relates to this franchise being adopted potentially after 3 readings. We did get some information from our partners here and learned that with respect to what is a typical or an average consumption of natural gas in our community, that tends to hover around $46 a month. That franchise fee impact, which again is not changing by virtue of this agreement if adopted, would be in the area of about $1 a month for the average consumer, which means that if consumption of therms relating to natural gas use in a home were to go up, that franchise impact could potentially go up, and for those who consume less, that impact would be less. And so with that, Mr. Mayor, we would recommend your favorable review.
Okay. Council will now listen to public comment. Public hearing comments are limited to 5 minutes, and no duplication of speakers will be allowed. At this time, I would ask those individuals who wish to speak in favor of the issues involving the amendment to the source gas franchise, please approach the lectern. Good evening.
Good evening. Thank you, Mr. Mayor. Thank you in council, and thank you, Carter. My name is Michael Howe. I'm the Community Affairs Manager for Black Hills Energy, and we've worked diligently with Carter, and we've met with Liz and the attorney's office on this, and we appreciate the partnership we have with the city. And at the risk of being corrected somewhere, the franchise renewal is actually for 30 years, not for 20. I just wanted to make sure that's clear, so we're all on the up and up there, and that's in section 2 of the ordinance. So beyond that, we just appreciate the partnership. We think it's a great partnership, and Black Hills Energy looks forward to continuing it with you. And it's also good to see Kelsey with the Casper Youth Council here.
Any questions for Mr. Howe? Councilman Cathy.
Well, and I'm not sure whether this is a question for you or for city manager, but it was stated that the franchise fee was based on number of therms. Is that correct? So it's based on volume of gas, not the price of gas.
That is correct.
Okay. Because gas prices can fluctuate greatly, as we have seen, and so I didn't want our customers to be impacted if gas goes from what I think Rocky's yesterday was 303, if it goes to $8, we're the customers not going to see any more franchise fee then.
And therms are pretty standard across the nation as a way of doing this. It also provides some stability for the city itself and some predictability.
Yeah, I'm used to dealing with it in BTUs, but yeah, I realize you sell it to the public in therms, but that's why I was curious in making sure that it was tied to therms and not the price per therm. So, thank you.
Any other questions or comments? Councilman Huber.
Thank you, Mr. Mayor. Sir, this doesn't have anything to do with this issue that's before the council right now, but I just want you to know how much I appreciate, and I think I speak for everybody else in the city of Casper, we appreciate the fact that your company is providing a very vital service and the product that's keeping all of us warm and comfortable, and we can take a nice hot shower in the morning and everything. And during these uncertain times, which I'm sure have been challenging for you and for your company, that's appreciated. And I think that, I just want to give you a pat on the back and a thank you for providing that vital community service.
Well, thank you, Councilman Huber, and my colleague Jonathan Boudreau is the gas operations manager for the Casper and Gillette area, and his team's largely responsible for that. And as long as I'm here, I thought I'd also say that we are very focused on COVID safety as well and providing safe natural gas in a COVID-safe manner. Our crews wear masks when they interact with the customers. We wear masks inside our facilities, so we're doing all we can as well to help slow the spread.
Councilman Hopkins.
Thank you, Mr. Mayor. As I understand the contract, you're basically going to supply natural gas, but if I read the contract closely, someday you could be supplying hydrogen. Now, I realize that would be taking a whole separate system. But am I reading that contract right, that you supply gaseous products?
We play
hydrogen.
We supply gaseous products, yes.
Okay, thank you, sir.
Thank you.
Is there anyone else that wants to speak in favor of the issues involving the amendment to the source gas franchise? All right, at this time, I'd ask those individuals who wish to speak in opposition to the issues involving the amendment to the source gas franchise to please approach the lectern. There being no others to speak for or against the issues involving the amendment of the source gas franchise, I now declare the public hearing closed. Please read the ordinance by title only.
Ordinance amending ordinance number 11-11, which is an ordinance that was granting a franchise agreement to Source Gas Distribution LLC franchise agreement.
The chair would entertain a motion to approve on first reading the ordinance just read.
So moved.
Second.
Moved by Councilman Bates, second by Councilman Johnson. Any discussion? Councilman Cathy.
I may have misunderstood you, but I thought you said this agreement was for 20 years?
Mr. Mayor, Councilman Cathy, you did not misunderstand me. That is precisely what I said.
Because this says 30 years.
Correct. And we were given the indication that it would be 50% more than that. Mr. Henley looks like he wants to add to that as well.
Mr. Henley.
Thank you. Actually, the agreement does say 30 years. You're correct, and I'm glad that a representative from the gas company is still here. But because this actually goes back and amends the other agreement that was adopted 10 years in the past, it really does only go on for an additional 20 years. So we amended that agreement, so it's a 30-year period, but it starts the date of that ordinance. When I read it too, the first time I went in and I talked with Mr. Trumbath, I said, okay, explain this to me. And so that's the explanation we have, and I think that's accurate when you go back and you plug these numbers in, the ordinance 1111, because that's what we're amending is the ordinance of 1111. We're not creating a new ordinance.
Okay.
And I hope that that's kind of consistent with the understanding of the other party too, because that's important.
All right. Any other discussion? Okay, any amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
All members voting aye, motion passed.
Please read the ordinance on third reading by title only.
An ordinance amending section 13.32.030 of chapter 13.32 of the Casper Municipal Code pertaining to Division 3 wastewater sewage discharge regulations.
The chair would now entertain a motion to approve on third reading the ordinance just read.
So moved.
Second.
Moved by Councilman Johnson, second by Councilman Bates. Council will now listen to public comment. Public comments are limited to 5 minutes, and no duplication of speakers will be allowed. Is there anybody that would wish to speak on this? Okay, any discussion? Any amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
All members voting aye, motion passed.
Please read the ordinance on second reading by title only.
An ordinance to limit the practice of massage therapy to certified massage therapists, license required.
The chair would entertain a motion to approve on second reading the ordinance just read.
So moved.
Second.
Moved by Councilman Cathy, second by Vice Mayor Lutz. Council will now listen to public comment. Public comments are limited to 5 minutes, and no duplication of speakers will be allowed.
Hello, my name is Thea Morton, and my address is 433 South Park. And I really do approve of the massage ordinance, and I really thank Councilman Cathy and Councilman Huber for like all the work that they put on the ordinance, because it's pretty well written. The only thing that I wanted to add is that sometimes when sports teams are like here, I know that that's not particularly happening right now, sometimes traveling massage therapists come into town for an event, and this is something that happens like Olympic-wise and all that sort of stuff. And I wanted to see if there was a way to add an exception for sporting events, where if a massage therapist is coming from another location, that they could have like a 24-hour exception or the length of the sporting event for when they do come in. And so that was my only comment on it. Other than that, I really approve where we're going on this.
Okay, thank you. Anybody have any comments or questions? Councilman Huber.
Thank you, Mr. Mayor. Ma'am, I think that what you're talking about is like if a team comes into town and they bring a trainer along with them, is that what you're getting
Not
at, or-
necessarily. So like one of the events that happens in Casper is there's a couple of extreme races that happen, but there's people that will come in, and when these races are finished, and let's just say that they're from other states or whatever, that are supporting their team or even just they know they can make money there, they will go to these events to offer massage and just have a tent, but they won't be from Wyoming or Casper necessarily, so they won't have a license. But there are a number of like nationwide massage therapists that do this, like for example, like for the Olympics and Special Olympics and that sort of stuff, as they do go to and follow these places around. And some of them just do it on a volunteer sort of basis, so it's not necessarily to make money. Like there are massage therapists that volunteer to do massage at Special Olympic events, but they might not be from here. And so I really thought it would be important that since Casper does host a number of larger events, to have that exception put in here, so we're not getting rid of like this one business for when special events are coming into town.
Well, are you just, because Councilman Cathy, I don't know that anybody brought this area up when we were looking into this. And I'm wondering, are you talking about like people who might, say like for instance, when we used to have the Casper Classic bike race, the Casper Marathon, things like that, draw in a bunch of people, are you worrying about someone who might come and in essence set up a booth there and say for, $50 I'll give you a post run massage or something like that, or are you?
I'm not worried about people not necessarily being certified. I'm more worried about that they wouldn't be able to practice in the city of Casper because of our city ordinance that we're talking about.
Well, are you?
Like I'm not worried about the competition. I guess I'm not.
Yeah, are you? Well, and I don't think I'm asking my questions really well either. But are you concerned about people, for instance, that volunteer as a part of the Special Olympics or something like that? Is that what you're concerned about?
Right. Like I would like to have an exception so that massage therapists are still allowed to travel to Casper to do that.
Yeah, if they volunteer as a part of an event like that.
Right. Like generally, I wish I'd written down like how the exception generally is written, and I can certainly email it to you so that like during the next.
Yeah, that'd probably be helpful, because what I'm trying to differentiate and make sure that I understand is if you're talking about people who volunteer to come as part of, for instance, the Special Olympics or
volunteers.
Yeah, as opposed to someone, well, and I'm just trying to distinguish about, for instance, if there's a big soccer tournament and someone comes and volunteers as part of the soccer tournament, people that are putting it on, or if they come in and are employed by the organization that's putting on the soccer tournament, or hockey, or baseball, or whatever it is, those people that are part of the official tournament activity, or whatever you call it, those people, if that's what you're saying, there should be an exception for.
Well,
or if you're talking about people that might sit there and say, well, okay, there's going to be this big activity here in Casper, a tournament or whatever. I'm going to bring my massage trailer or something and set up a little booth somewhere and offer massages. Are you seeing a distinction there? Or?
I don't think there necessarily should be a distinction, because I think that like both people are going to be attracted to sporting events. There are going to be people who are doing it for money, and there are going to be people who are doing it just as a volunteer sort of basis because it's like an organization that they're passionate about, like Special Olympics, just as an example. So I think that when it comes to an exception, we need to make room for both people who are coming into Casper to make money and people who are coming into Casper on a volunteer sort of basis.
Sure, okay.
Can I just take a shot at this real quick? Because I think I know where you're coming from. If they live here and they're going to make money on it, they're going to have to go underneath our ordinance. What you're saying is the Spartan race comes into town and they have massage therapists that come into town with them.
With them or people that
Or separate, but coming into our community for the purpose of giving massages at that event. That's what she's saying. So it has nothing to do with local people. It's people coming, and it could be for 24 hours, it could be for 72 hours, but those people from outside the community. Okay. Councilman Cassie.
Did I understand you right that you said you had an excerpt from?
Yes.
Could you email that to us?
Absolutely.
Would appreciate it. That way we can actually sit down, read it, look at it.
Pay to listen now.
Now that we understand. Do what?
I think that was Pacheco.
It's the caller on the phone.
Oh.
Sorry, I think they're getting it ready for.
Oh, okay.
So I think that's what the
Oh.
Oh, okay.
Yes, I can do that. I can definitely email that to you.
Excellent.
You and Huber.
And I just, Mr.
wanted
Mayor.
to clarify that it was like, if I'm a masseuse in Cheyenne and an event's held in Casper, I can travel to Casper to provide services. That's your
Right,
concern.
on a temporary basis.
Right, okay.
Without actually filing for like the establishment fee and the massage therapy.
Right, okay.
Did you have something further, Councilman?
Actually, I sort of did. I'm hoping that, I see that Mr. Seek is here, and I would invite any other of our local massage therapy folks that might be listening in to please email any thoughts that they have about this to us, because I think this is a new little area that nobody really thought about.
Right, and I just recently found it, so that's why I came today.
Yeah. Thank you.
Okay, thank you. Is there anyone, oh, go ahead.
Thank you, Mr. Mayor. Tracy Aguilar, 1541 Diamond Drive is my business address, and I do want to echo what she says. As being a team therapist and traveling with teams, we do have hockey teams that do come in. You know, when we had junior hockey, they did bring therapists in, so I think having something where they could apply for like a temporary license based on what they carry from their state, I think would suffice. So I just wanted to say something about that. Thank you.
Okay, thank you. Any comments?
Any questions?
No questions? Looks like we got our ice back up too, by the way. You're welcome. Is there anybody else who would like to comment on this?
Yes, I'm Michael Seek. I live at 932 South Spruce.
I've been practicing massage therapy in Casper for over 35 years, and so I've been involved in the massage business for a long time. And I actually am in support of this ordinance. I think it's overall a good idea. I do have some questions and comments about certain parts of it, but maybe it would be better just to email my concerns, because I don't know if this is the place to talk about dotting your I's and crossing your T's. But I do have some concerns and would like to.
You could bring those concerns up here if you feel comfortable and email them. We can go that route too.
Okay. Well, one of my concerns is the title is to limit the practice of massage therapy to certified massage therapists, but then it doesn't define certified massage therapist anywhere in there. And I think that should kind of be in there. Don't you think? And then also, on the grandfather provision, paragraph 2 seems to contradict part D. Basically, the first part says that the grandfathering position will allow local therapists to get their license without having taken the MBLEX exam or graduated from 500 hours of school, period. And then the second part of that says, however, they still have to take the test, and get 500 hours of schooling, and the two seem to kind of contradict each other. And then also, concerning the grandfathering clause, it doesn't have a time limit on it. Most grandfather clauses only are available for a short period of time, and this doesn't mention it, so it kind of gives the idea that 10 years from now I could be grandfathered in, and I don't think that's the intent. And then I also have some concerns about the titles massage therapists, massagists, masseuse, and masseurs. Personally, I think masseuse and masseur, they're sexist terms. They're French for a man that gives a massage and a woman that gives a massage. And you would not be a masseuse, you would be a masseur. But those two words have long since been tied to the massage parlor image that the professional massage therapy community has been trying to distance themselves from. So I kind of think we should step back and maybe not give those two words any credence, even though they're technically correct, you know, French for a man that gives a massage and whatnot. And then the massagist part, I'd never heard that word until a few weeks ago, and I looked it up in the dictionary, and it does exist, but it basically just means a person who gives massage. But my problem with that is it's easily to get mixed up with the word misogynist, and that I think is just bad decorum. My suggestion would be to use terms like massage therapist, massage practitioner, massage technician. That better describes a particular therapist's approach to their practice, and they're all technically correct. And those terms are used broadly in the massage therapy community. And that's pretty much all I have to say.
Okay. Councilman Cathy.
The words massage, yeah, those last three terms you were talking about were primarily left in there for the legalese part of it, because what our concern was is we did not want somebody, oh, I don't need a license. I'm not a massage therapist. I'm a masseuse. That isn't what the game we're trying to play. So that's why those terms were left in there at the request of legal.
Okay.
Okay? So nothing against the massage therapy people or anything else, but this was trying to narrow it down from a legalese standpoint to be able to prosecute, if need be, people that were trying to practice illegally.
Oh, well, okay, I'll just agree to disagree with you.
That's fine. I appreciate that, but that's the reason those were left in there. And I felt that I owed you an explanation, because I know in our discussions that was brought up, and I wanted to give you, because I did follow through with that, and I wanted to give you an explanation of why they were left in there.
Okay, I appreciate that.
You bet. That was.
Thank you.
Elizabeth Scott, 337 South Conwell. I am here today because there's a drive among you to regulate something, anything, and in this case, massage. I'm going to exercise my rights of freedom of speech as a taxpayer, a businesswoman, a massage therapist, and a reputable member of this community. While the public good, health, and safety is a justification for these regulations, it is really personal agendas that are pushing this through. There is a lack of good intention and a consistent use of misinformation and systematic tactics that marginalize, ignore, discriminate, or discredit those who oppose these regulations. Let's first take the first false statement. We are going to get licensing in massage in Wyoming. The chances of getting licensing in Wyoming are nil to none. The state legislature is not going to waste taxpayer dollars, time, and resources to regulate a back rub. I have been involved in massage licensing the 3 or 4 times it has come up in 25 years, and it has not gotten out of committee. I repeat, it has not gotten out of committee. One time it never got introduced to committee. The next false statement. Most of the massage therapists are in favor of this regulation. Those of us who have raised these concerns, objections, and pointed out the problems have been ignored, interrupted, shouted down, or marginalized because those folks promoting this don't want to hear what we are saying. Our opposition doesn't fit with their agenda. Those massage therapists in favor of these regulations are for the most part young and inexperienced in business. They don't understand that once you get government in your business, you never get it out. They don't understand that regulation is expensive and it can cripple a business. Look at the coal industry. Wyoming was once the 5th largest producer in the world of coal. Due to regulations, our mineral industry is tanked. It is the mineral industry that pays our way, allowing us to have a low cost of living, low property taxes, low sales tax, no state income tax. This is about to change for all of us. The most immediate change is Casper will have budget cuts. They don't understand that government can and will arbitrarily change these regulations to something far worse and more restrictive and can change the amounts to more exorbitant rates. They don't understand they give up many personal freedoms to run their life, business, and occupation as they choose. They don't understand there is no recourse, redress, or appeal on these regulations. They don't understand that all the justifications cited, i.e. recognition, legitimacy, reputation, are determined on a personal basis in the marketplace. Respect cannot be legislated, it has to be earned. Do you know that the New York Giants used to come to Wyoming 50 years ago to be worked on by a Finnish massage therapist in Thermopolis before they started their season? She also worked on boxing teams. Reputation is personal. Now let's look at these regulations specifically. The use of the term certified massage therapist limiting to such does not define certified or the credentials required. Actually, what I understand of certification, this is similar to limiting the medical field to surgeons only. Next definition of massage, pretty fancy name for a back rub. I use a technique called proprioceptive neuromuscular therapy.
1 minute, ma'am.
Fancy name for a stretch. Next, there is the term 500 hours current accredited school curriculum is used in several places. First problem is many of us have paid for and gotten instruction from AMTA and other body working associations who have promoted instructors, lectures, clinics, courses, etc., which by these regulations are no longer valid accreditation. Next, such 500-hour courses are expensive and require traveling out of the community and even in the state. 500 hours does not necessarily mean certified massage therapist, but can require additional test or cost. The biggest issue here is this is a maximum education requirement. In all other occupations, the education requirements are minimal and people can work at whatever level of education they have acquired. For example, public accountants.
Ma'am, I'll have to have you wrap it up.
I will. Certified public accountants, CNAs versus nurses, PAs versus nurse practitioners versus physicians, and so on. The word current also has legal connotations. For instance, the permit lasts 2 years. Suppose in 2 years, when you the school you have received your credentials is closed and is no longer current when you fill out your new application. This language invalidates previous accreditation. Section 804-090, business must be licensed as massage therapy establishments. It can only.
Okay, I'm going to have to ask you to stop.
This directly affects my business and puts me out of business. I'm going to exercise my right as a taxpayer.
Well, you've had 5 minutes, and that's what the limit was. So,
Thank you.
Thank you.
I'm going to continue as a taxpayer. I have a right.
I'm going to ask you to stop.
You are rude.
Well, you have 5 minutes.
I have a vested interest in this as well as other therapists, and I have a right to be heard because Mr. Cathy did the same thing in the work sessions and I never got to be heard. I am going to be heard today.
You are done.
Make myself clear.
You are done.
I'm a taxpayer. I pay your salary. I will have my say.
Okay. You're done though, ma'am.
So, do all of
any questions?
As a massage, have a technique or a form of treatment, have to be certified as a massage therapist.
Excuse me, ma'am.
Or to get a permit to do their business, do they all have to have a license? The language is not clear here.
Ma'am, it's
This
unlawful
reads.
for you to disrupt a public assembly, so I'm going to ask you to desist. If you want to talk with me out in the hall, I'd be more than happy to talk to you. It's unlawful for you to disrupt the ongoing business of the city.
This is my business
let's go
too,
out-
sir.
let's go outside
I am
and
a
talk.
taxpayer. This is my business as well.
If you
This
insist
affects
on, ma'am, if you
directly
insist
my
on
business.
disrupting this lawful business of the city, you can be arrested, and we will do so.
It is
Let's go out-
unlawful for the city to shut down businesses.
Let's go out and talk.
This is not doing the public good by passing this. And there's lots of things wrong with this
Let's keep moving.
ordinance.
Okay, is there anybody else who would like to speak to council in reference to this ordinance? Okay. We will move on to discussion. Councilman Johnson. No.
I would like to make sure that what this gentleman brought to us earlier is something that we would need to fix before we pass this ordinance on third reading. So I want to see that and make sure that this is buttoned up correctly.
Councilman Kelsey.
That was, excuse me, that's what I was going to ask, if we could get this added onto our work session to be able to go over those comments, to then make amendments as we would see fit to come up for the third reading, if that would be possible.
Mr. City Manager.
Mr. Mayor, as long as the council's comfortable with that, we would be happy to get that ready for the next conversation.
Are we good with that and that on, or did you have comments to that?
I do, and I would ask this to Mr. Henley. The inconsistency that Mr. Seek pointed out, that the title talks about certified massage therapist, but he couldn't find that definition in the ordinance. I don't think I recall that being specifically defined in there. I wonder if this would be a thing that could be just a real easy fix to just say in the ordinance that a certified massage therapist shall be all those persons who have complied with all of the requirements of this ordinance and are licensed by the city.
You know, that certainly could, if you, excuse me, Councilman, that certainly would be, if you feel that's necessary. Obviously, what we did here was to create a permit system. And if you want to say that by getting a permit that you're not certified, it seems to me that if you're getting a permit, you are certified by the city of Casper. But if there's if that's going to confuse some people, by all means, we can certainly clarify.
Well, or do you think we should change the title of the ordinance to licensed massage therapist instead of certified?
Could do that as well, yeah. That would be probably pretty accurate, you know, permitted or licensed.
Mayor, I always get confused when we can offer amendments, but I'd offer that as an amendment that we amend the title to change it from certified to licensed, because the city's really not certifying these people, we're licensing them.
So we'll come to amendments in a moment. We'll finish the discussion. We'll come back to amendments, and I'll have you amended. Councilman Hopkins, did you have something?
Thank you, Mr. Mayor. I will continue to oppose this. I really believe that, while the intent is good, and I understand where we're trying to go, we've in effect outlawed any kind of what might be a mobile massage service. Now, everything else is going mobile. You're having food trucks. You can get groceries delivered. And we have, in effect, outlawed a mobile massage parlor. And I understand where we're trying to go with this, but that's one reason. The other problem I still have is I really believe the grandfather clause that we have is arduous, to say the least, and in fact, it will put people out of business. And so for that reason, I'm going to continue to oppose it. Thank you.
Vice Mayor Lutz?
So for those of you who were here at the last meeting, we had kind of a pretty lengthy discussion about the credentialing necessarily of somebody who doesn't meet the traditional, sorry, not traditional, but the expectation of the 500 hours at school or passing one of the exams. And after rereading it and discussing it with Councilman Cathy, what the plan is and the way it's worded is to leave up that credentialing of basically individuals being grandfathered into the clerk of court. And so, you know, we discussed multiple things like, you know, showing tax returns, you know, that you've had an active operating massage business, you know, for X amount of years, or things of that nature. And so that would be in the clerk's discretion versus us adding it into the ordinance.
Mr. City Manager, I jumped over you, I'm sorry.
Oh, sorry.
No, that's okay, Mr. Mayor. What we would recommend is that we take up the matter on the pre-meeting of December 1, which is pretty tight as it relates to the timing of the next reading, which would be that evening in the regular business meeting. But the reality is we don't have another work session before that time. And if we can get the amendments prepared for you in advance and have you get them in advance, we may be able to cover that in the pre-meeting and prepare amendments for the floor that evening.
I forgot we didn't have a meeting next week.
Right.
Yeah, that's right.
Councilman Bates.
Thank you, Mayor. Just to double check, if you don't mind, City Attorney, that the mention that the current ordinance would not allow individuals from Cheyenne or another state or whatever to come in for a special event and do the massage. Is that, to your knowledge, accurate? Do we need to put something in there for that? I'm just checking in with you.
Great, thank you. Mayor, Councilman, as a matter of fact, that would be accurate if they're going to actually receive compensation. Basically, massage therapist in this ordinance references people who provide or administer to another for any form of payment or consideration. So if it was just a volunteer who was attached to a particular sports organization, Casper College travels, or we get somebody from Nebraska who travels here with their massage therapist, they would not be required to comply with our ordinance. But if they're actually out, getting payment and consideration in that regard, setting up their own tent outside the soccer complex and taking money for it, under this ordinance, like any other massage therapist, they would have to have a permit.
Mr. City Attorney, I'm just sitting here thinking about this. Really, that would fall under, like, the way it's written now without that written in there. When we have CNFR come in here and we have sports medicine with it, that would not allow them to do their massage, correct?
That may not allow them to do their massage. I'm not sure how they get compensated, but that may be a detriment to them, yes.
Okay. All right. Any further discussion? Okay. Amendments. Councilman Huber.
Thank you, Mr. Mayor, and thank you for guiding me skillfully to the right time to do things. I would just like to amend the title of the ordinance to be licensed massage therapist instead of certified, just to change the word certified to licensed. And actually, and I know I'm a little bit out of order with my timing here, but I also think, Mr. Henley, and correct me if I'm wrong, that might make it a little bit more consistent with the licensing idea of the whole ordinance.
Mr. Henley.
Thank you, Mayor, Councilman. I think you're right. That would be kind of consistent with the licensing. And I would ask if you wouldn't mind, instead of just in the title, if we could just supplant anywhere it says certified licensing or certified massage therapist, put licensed massage therapist, just so.
I'll make my motion in accordance with what Mr. Henley just said.
Okay, so a motion on there to change the name to licensed massage therapy and to put licensed massage therapy anywhere it says certified massage therapist. That's on the table. Do I have a second? Second. Second by Councilman Bates. Any discussion on that? Okay, any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
All members voting aye, motion to amend passed.
Okay, so any further discussion on the amended ordinance now? Okay, any other amendments? Any abstention or nay votes?
Nay.
I'm going to vote nay, not because I disagree with the ordinance. I just am not comfortable with their language currently.
Okay, all voting aye?
Aye.
Please record the vote.
Council members Hopkins and Johnson voting nay, motion passed.
Council now discuss a resolution of support for healthcare workers. Because this is not on the consent agenda, it will be open for discussion by council. Please read the resolution by title only.
Resolution of support for all healthcare workers.
Chair would entertain a motion to approve the resolution just read.
So moved. Second.
Moved by Councilman Bates, second by Councilman Johnson. And Mr. City Manager, report on the healthcare workers resolution.
Thank you, Mr. Mayor, members of the council. Pursuant to your request of, I think it was a week ago, actually, we prepared a resolution for your consideration. We also added the feature in the event that we had the opportunity to erect a message that would accompany the spirit of this resolution, so that folks in the hospital facility located next to Conwell Park might see that manifestation of what it is that you potentially pass this evening. And so that allowance is included as well.
Okay. We have two different callers who would like to speak on this.
Hello. Your Honor, we have Miss Linda Bergeron on the line.
Okay. Ms. Bergeron, go ahead.
My name's Linda Bergeron. I live at 2255 South Larkspur. First of all, I commend the healthcare workers. I think they're crucial and they do a fantastic job. I have a concern that I'd like to bring forward, and that concern is Vince Prager says that as government increases, personal responsibility decreases. And I would just like to encourage individual use of personal principles. And I'd encourage the City Council going forward to keep that in mind, that probably people have real strong principles regarding the pandemic, and I think people really do try hard to be very careful about hand washing and social distancing, and I just think that we should leave that in Wyoming, in our independent state. We've always been a real independent people, and I'd just like us to really encourage the real strong personal principles that Wyoming people have, and that we refrain from governing that extensively, and we just go forward with being united and trying to do our best due diligence. So that's what I have to say.
Okay, thank you.
Thank you very much. Your Honor, we also have Ms. Pam Elrod on the line.
Okay, Ms. Elrod, go ahead.
Yes, my name is Pam Elrod. My address is 1292 Dusty Lane. Thank you, Mr. Mayor, and all the health workers. We do appreciate all of you. The resolution support for all healthcare workers bring up some questions that I would like to address. The healthcare workers answer to the guidelines of the health department. It is important to question the connection with supporting the healthcare workers, while at the same time supporting the health department. After all, the narrative that they support with advertisements in the Hospital Post magazine and many others, it is clear what they are all wanting to accomplish. The question we have to ask is, would this resolution put the health department having precedence in making decisions or influence the council's enforcing health restrictions? Moving forward, I need to point out issues concerning the health department, if they are going to be involved. It is concerning the mixed messages and unclear reasoning concerning health issues. One very controversial subject would be the mask. It seems to be dismissed that many healthcare workers are against the mask for health reasons, but are forced to comply and don't feel they can speak out. In the video I sent to the council, OSHA is saying that PPE, personal protective equipment, is not the first line of defense, because wearing the mask reduces oxygen levels 20% and massively increase CO2 levels. So masks are not approved unless NIOSH certifies them. Fauci and Health Department and OSHA for years said all these masks we are wearing are ineffective or dangerous. When I got my blood work done, the healthcare worker said they are allowed only 30 minutes of wearing a mask. Yet the health department is wanting us to wear any kind of mask with no time limit mentioned. You can see why we have to ask questions. OSHA did not pass my husband's fit test for respirators because his lungs were not strong enough. It is illegal to require someone to wear a mask that has not been certified. Why does the health department not have to prove their narrative of having to wear a mask, and why they recanted the science they claimed to have? It has been proven that the COVID-19 tests have been manipulated across America and the world for an agenda or money. Therefore, any of these statistics are compromised. Why doesn't the health department give us statistics comparing the other flus and diseases, where it would show this is not a pandemic when deaths are less than 1%? And this is in respect to those who have lost loved ones. This disease is a killer, but no more than the influenza and others. The hospitals are suffering because of the unprecedented choices of lockdown. They knew there would be more COVID, but now we have a backlog of sick people. Hopefully we have learned our lesson. Why is there no one to hold the health department to a standard and keep them in check? Our elected officials, the legislature gave this appointed organization free rein to govern the people. This is unprecedented and it is going on all over. We the people have no recourse. This is when the elected have to do their due diligence in researching what is good for the whole people, not an agenda. Why doesn't the health department, instead of pointing their finger at the people, talk about the proven medicines that doctors are finding in their practice of caring for patients with COVID, and talking about the very effective preventive care? The health department doesn't talk about that this should be the first line of defense, not the mask, which is proven to be ineffective and dangerous. It is unprecedented that anyone would pass a resolution to support anyone. It is sending a negative message, and that the community has to follow along. Can we support all of our workers in the fight against the COVID without making a resolution? These are my concerns. The elected officials make decisions honorably, but hopefully not in ignorance of all facts and possible litigations. We hope this resolution doesn't allow decisions to be compromised in favor of an appointed organization. And if I may add, when people do care and are as caring like you are as counsel, it is hard not to make decisions on feelings or your heart. Please make decisions on merit. And I send my God's blessings to you as a city council as you move forward. Thank you very much.
Thank you, ma'am. That's the only two we have. Okay, we'll move on to discussion. Any discussion? All right, any amendments? Councilman Bates.
The only amendment I'd like to put in there is, whereas, and I know that there's a part in there that talks about it, but I just like to include where it says healthcare workers. I'd like anywhere that says that, I would say and first responders, because I think they're just as valuable, and I think they need to be a part of that as well. So, and I know that there's a section, I didn't print it out, at the bottom it talks about first responders, but where it says healthcare workers and first responders, I'd like to add amendment to add that into it.
So there's an amendment by Councilman Bates to add in the words and first responders. Do I have a second?
I'll second.
Second by Councilman Powell. Any discussion? Okay, any abstention or nay votes?
This is on the amendment.
This is on the amendment. All voting aye?
Aye.
Please record the vote.
With all members voting aye, motion to amend passed.
Okay, so back to any discussion on the amended. resolution.
Mr. Mayor? I'd like to express my appreciation to city staff for putting this together. It's very well written. I hope it has the desired impact, because you see in the media many times the people in our hospitals will say things like, it doesn't feel like the community has our back. And I want to make sure they understand that we are behind them, and we are the voice of this entire community. We appreciate everything they're doing. We know it's tough. None of us know how tough it is because we're not in those situations. But they are in very difficult circumstances, and we all appreciate what they're doing.
Any further discussion? Any further amendments? Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
With all members voting aye, motion.
Please read the consent resolutions by title only.
Item 13B1, the acceptance of a justice assistance grant. Item 13B2, the purchase of an ADA lift-equipped van and options for future vehicles from Creative Bus Sales. Item 13B3, an amendment number 1 for the contract for the aerial mapping update with Fugro USA. Item 13B4, amendment number 1 for the contract for quality assurance for the aerial mapping update with AECOM. Item 13B5, naming the new park Horizon Park. Item 13B6, a contract for the Fire Station number 1 alerting project with WestNet Inc. Item 13B7, amendment number 1 to the Morad Park Walmart Trail project funding agreement with the Wyoming Department of Transportation. Item 13B8, authorizing a contract for outside city water service with Mary Robinette. Item 13B9, authorizing submission of a Trails Program grant for the, from the Wyoming State Parks and Trails for the Rails to Trails extension to Ennis Kimball Wilkins State Park. Item 13B10, authorizing submission of a reimbursement application to the State Loan and Investment Board for an allocation of Coronavirus Aid, Relief, and Economic Security Act monies. Item 13B11, authorizing an amendment to the fiscal year 2021 budget. And item 13B12, authorizing a contract for outside city water service with Bradley and Charla Barclay.
The chair would entertain a motion to approve the consent resolutions just read.
So moved.
Moved by Councilman Johnson, second by Councilman Bates. Mr. City Manager, would you like to comment on any of the items? Okay. Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
With all members voting aye, motion passed.
Please read the consent minute action title.
Acknowledging a change in corporate ownership for Bar and Grill Liquor License Number 1, doing business as Sasumo, located at 320 West First Street.
Chair would entertain a motion to approve the consent minute action agenda item just read.
So moved.
Second.
Moved by Councilman Hopkins, second by Vice Mayor Lutz. Any abstention or nay votes? All voting aye. Aye. Please record the vote.
All members voting aye, motion passed.
This time we ask council members to bring forward relevant concerns or items of interest. Councilman Johnson.
I just wanted to say that when I said that I want to leave it up to the discretion of the city manager on enacting a mask mandate inside city facilities wasn't to pass the buck, but you work here every day. These are your employees. I don't know what other precautions you guys have taken, so I just trust that you would make the right decision, and you should have that discretion.
Councilman Powell.
Changing the order on me, Mr. Mayor. I appreciate the discussion about what we can do in response to the virus tonight. I want to collect my thoughts here. We've all been concerned about this since March and talked about it over and over. And it's unfortunate that things have become so contentious and people have gotten in their camps. But I would like to point out something that I think should be obvious to everyone. The enemy here is not people like me or the doctors who have been raising concerns and basically trying to point out how serious this is. The enemy is not people going to rallies and not wearing masks. The enemy isn't the people who've criticized him for doing that. The enemy is not people in China that I guess like to eat bats for lunch. The enemy is not the Chinese government that sent it our way and forgot to warn us or didn't care to warn us. All of those things are a distraction. The enemy is the virus, and it is winning this battle. And so I appreciate everything that our health department has done with their Casper versus COVID campaign. Mr. Mayor, I appreciate your public service announcements. I know you've been putting a lot of time into this and meeting with people. We've been wrestling with what to do with this. But I think, for me, all of those efforts that we have made thus far, and I think the data is showing this because we're skyrocketing, and it's going to get worse as we head into our holiday season, unfortunately. I feel like as a community, we've basically been trying to take down an elephant with a pea shooter. That's how it looks to me. And I hope I am wrong about this, but the things we discussed tonight, I think in the coming weeks, events are going to force governmental entities to consider actions that are far more draconian than anything we have discussed thus far. And I want to emphasize that I would love to be wrong about that. But we are in a very, very serious situation. And Councilman, I have read some of these studies about masks. And research design and statistical analysis, something I know a little bit about. And I haven't read that one, but the ones I have read that people like to cite and talk about can just charitably be referred to as junk science, where people start with a conclusion and work backwards from there. And so I hate to always be a downer about this, but if we look at the numbers, things aren't going to stay where they are. They're in all likelihood going to continue on these curves, and we are going to be looking at more and more serious actions to try to get this thing under control. So I wish it weren't the case, but everything else we seem to be working on right now, the importance of that is going to pale by comparison.
Councilman Hopkins.
Thank you, Mr. Mayor. Earlier, we discussed our new agreement with the gas company, Black Hills, and I mentioned in there that if I read the contract correctly, they do have the right to supply us hydrogen. There's a lot of work going on with that, but it's not compatible with the pipeline system we have now. Hydrogen just wouldn't work that way, but they do have that ability. That's one of those things that's coming down the pike, and it may be very helpful to us from an energy standpoint. Not to be putting down the oil business, because this got to come from somewhere. But the other one that's probably even a bigger piece of this that's coming our way, and it's quicker than we think, is going to be when a lot of people start buying electric cars. I don't know if you're aware of it, but you don't have enough electrons flowing down your alley to supply 5 cars on a block. If you look at the charging lines going into a nice new Tesla, it's about that big around. And it's 800 volts. We simply don't have enough power available in our power system to allow everybody to buy an electric car that's going to want one. And the way the system works now, you will end up paying what's known as a demand charge. If you plug your car in and it pulls 400 amps for 8 hours, that sets your electric rate. That's the way it works now. And so I think the next time we be looking at a power contract, and that's going to be long after I'm gone, we need to start looking at this because there's simply not the infrastructure out there to allow even a third of the people in our first city to own electric cars. It just doesn't exist. And the way it is now, they have to go back to the lines and put in new lines starting everywhere. We put this 100 kVA line around, it's not going to be enough. when you look at the BTUs that your car consumes, no matter how efficient the electric car is, you're still going to be in the same ballpark. So one of these days, and I would suggest that we look into this very carefully, that we look at how we do this in the future, because it's going to be important to us. That's all I got to say. I'll get out my box.
Councilman Cathy.
A couple of things, and no, I'm not worried about the oil and gas business because people still haven't figured out yet that the interior of their electric car comes from petrochemicals. So you're still going to need the oil to build the car. But anyhow, beyond that, went to a water board meeting today, and unfortunately, it looks like the EPA, the federal government, may force the regional water system to install UV disinfection. If that happens, we are probably looking in the neighborhood of $11 to $15 million project that will need to be designed and funding will need to be figured out for. But we had looked at trying to push back against the EPA, and based on current data and previous cases, it looks like that is a losing proposition that could potentially cost us between $250,000 and $500,000 million just to do the testing, and then probably get a no from them. And if the DOJ gets involved, then they can then fine us, and once some of those things start happening, we would lose any options for either state or federal funding assistance. So that looks like that may be coming down the pike within probably the next 7 to 10 years. That through the planning, the fundraising, the construction, so that's kind of the time frame. Hate to be the bearer of bad news, but that's kind of what it's looking like. Because the North Platte River has been reclassified into a bin 2 category because of cryptosporidium. But yet, to run a test that would prove that we don't need to do it is our river doesn't have enough in it to be able to run the test. So you just want to beat your head against the wall and the EPA. That's all I have tonight. Thank you, Mr. Mayor.
Councilman Huber.
Boy, like Councilman Powell said, you are bouncing around.
I am.
Oh,
keep you guys on your toes.
Just to follow up on what Councilman Cathy just talked about, this whole business that the regional water is having to go through right now is incredibly frustrating because, and to repeat what he just said, this is all about cryptosporidium, which is something that it's a bad actor and you don't want it in your drinking water, but there's not enough in the river to run the tests to prove that we don't have to install one of these systems. And our well field is categorized as a surface well field. If it was categorized as a real well field, then it would be a different thing. It's just incredibly difficult doublespeak, but unfortunately, I think that the regional water system and the city of Casper is going to be made to pay a big bunch of money because of this, and it's frustrating. But get ready, because a lot of big places, New York City, Portland, Oregon, other places have tried to fight this, not successfully. I'd like to just take a minute here to comment on something else. You know, Mr. Hamill, I think that's his name, the guy that spoke first here tonight, I'd like to comment on some of the thoughts that he expressed. And first, I want to really admire that he has the courage and the dedication to our community to take the time to come in here and voice some frustrations that many people, I think, share. People are having a tough time right now. They're grieving over friends and family who have died. They're worrying about gravely ill friends and family members. They're worrying about people who have otherwise suffered from fallout from health and economic problems. And I think we need to be aware of that many people are having these worries, and it's really affecting them. It's troubling whenever I hear people say that, well, politicians and government take and take and take and take from the citizens and give nothing back. Now, we all know that taxes go to support a lot of really important things. I happen to be one who believes that, especially here in Wyoming, we as individuals, and here in Casper, we get a great deal for the taxes that we have to pay. We get a lot of really good things, but we need to be sensitive that not everybody understands that, and I think sometimes maybe we need to try to point those things out politely to people, that the government provides a lot of services. And along those lines, I want to say that I think that we need to be really circumspect sometimes about some of the comments that we make and some of the things that we say. I do not think that it does anyone a service when we cherry pick studies or other, quote, facts that are kind of designed to support our feelings that we have. We need to look at the whole overall picture of what science is telling us about any kind of a thing and what the facts are directing us towards with reference to any issue, and not just be cherry picking certain isolated things here and there. Those are the only things that I have to say tonight. Thank you.
Councilman Pacheco.
Nothing tonight, Mayor. Thank you.
Okay, Councilman Bates.
Thank you, Mayor. There is no meeting for Casper Housing Authority for this month or next month. No meeting for Casper Utility this month, so they are looking at possibly one in December, but usually they don't do one. So it's up in the air right now. So I have nothing to report with them. Historical Preservation Commission has been doing a virtual, and I have not been able to attend those on virtual. So I don't have anything to report on that. Other than that, that's it.
Vice Mayor Lutz.
Nothing tonight.
Okay. One thing I got to add is I said I would give some numbers out. Dr. Dunn said there's 59 COVID patients in WMC as of tonight. The number's down a little bit from where it was earlier today. Respiratory clinic is, of all the people going through that, it's about a 35% positivity rate of people with COVID going through there, and there's been large amounts of numbers going through there. So we've got a sick community, and we need to do what we can to slow the roll here. So whatever it takes, we definitely need to do it. Don't have any details on I was just looking, thanks Kyle for sending that to me. I was just looking at the article on Oil City, and it's out through the Star Tribune, but I don't see an actual what the order says. It just quotes a lot of people saying the same thing I'm saying. I don't know what it says. So as soon as we get a copy of that, obviously, we'll be able to comment. So next meetings of the City Council will be a regular council meeting to be held at 6 p.m. Tuesday, December 1st, 2020 in the council chambers, and a work session to be held at 4:30 p.m. Tuesday, December 8th, 2020 in the council chambers. A notice of an executive session to take place at this date and during this meeting was given. We have a matter to discuss regarding property acquisition and personnel. Therefore, the chair would entertain a motion to adjourn into executive session, and at the conclusion of that executive session to reconvene this regular meeting solely for purposes of adjournment of this regular meeting.
So moved.
Moved by Councilman Hopkins, second by Councilman Bates. There being a majority of members present and a motion to adjourn into an executive session having been moved and seconded, and that motion requiring a 2/3 majority of the council present. Any abstention or nay votes? All voting aye.
Aye.
Please record the vote.
All members voting aye, motion passed.
A greater than two-thirds majority of the council present voted in favor of a motion, and we are hereby adjourned into an executive session.